Take a moment to get focused. Today we train with purpose.
The patient's crashing, blood pressure's low, heart rate's low, they're going into shock. Hey, I need you to go ahead and start an epidrip. Start it at 4 and 250. I want you to run it at 8 micrograms per minute. Now, when you hear something like that, what goes through your mind? Well, hello, everybody. I am your host, Coach Joshua. Thanks for joining us live for office hours. Today, we're going to talk about a really, really important topic. And we're going to continue something that we started last week, and that is the topic of med math and drug calculations. For many people, med math and drug calculations causes all types of anxiety, confusion, all of that. Well, after today, I want to make sure that you are no longer confused about this topic of how to do drug calculations. So we're going to kind of pick up the story from where we were last week. What I encourage you to do is go back to that video from last week. It kind of laid the foundation. We went through a lot of the formulas, but today I'm going to show you how to make this so much simpler. So thanks for joining us, everybody. I see we do have some people live with us on Zoom. For those of you on YouTube or Facebook, hello. What I want you to do is make sure that you're actively participating, make sure that you're responding and all of that. So for those of you in Zoom with me, I'm going to go ahead and drop the worksheet or the workbook that we're going to use today. I'm going to go ahead and drop that in the chat. I've now done that. So make sure that you have that, and you can just kind of follow along with me. So you can either just use your electronic device or whatever you need to do. You can download that, print it, whatever you want to do. But I do want everybody to participate. For those of you on Zoom, make sure your cameras are on. All right, let's just go right into it. So let's make sure you've got my screen. And by the way, how's everybody feeling? Well, let me ask you this. When you hear drug calculations, what goes through your mind? Just give me a comment in the chat. Let me know. When you think about this whole topic of, oh, I got to do med math, what goes through your mind? Type it in the chat. Let me know your reaction to that. Does it make you feel good? Do you feel confident? Do you feel scared? Do you feel anxious, nervous? Are you totally at ease? How do you feel when it comes to you've got to maybe calculate a drip or that kind of thing? Let me know in the chat for everybody. Okay, so we have kind of mixed reactions. Some people feel okay, some people don't feel okay. All right, not a problem at all. So last week, I introduced a whole bunch of formulas to you. The thing about these formulas, okay, so look right here. So here we have dose over hand times quantity. Okay, and that's kind of the universal formula as I introduced it to you last week. Then we have another one. Well, in this one, we have milliliters times drop factor times minutes. Okay, that's when you're going to be calculating a drip, for instance, and you're going to be using certain IV tubing. Last week, I talked about your different types of IV tubing, whether you have a 10 drop set, a 15 drop set, a 20, or a 60. Of course, the 60 is our micro drop set, and then the 10, 15, and 20, those are our macro drip sets. Now, what that means is in 1 milliliter, how many drops make up 1 milliliter? So if you're using a 10 drop set, you get 10 drops in this 1 milliliter. But if you're using a 15 drop set, you now have 15 drops in this 1 milliliter. But if you're using a 60 drop set, now you have 60 drops in the same milliliter. So depending on your drip set, it changes the size of the drops. Well, that makes a difference. Sometimes you need those drops to just flow very quickly, especially if you need to give a lot of fluids. Other times you need to give a very precise dose. Now, we talked about that last week. We also gave you this other formula, dose times 60 times weight times concentration. That's just 3 right there. Now, let me show you, but that's not all the formulas you need to know. Stay with me now. Now, on this sheet here, I have actually a total of, I think, 18 formulas. These are the most common formulas that we use in medicine. So imagine if you've got to memorize all 18 formulas. Well, when do I use what? Do I use dose over hand? Do I use the drop formula? Do I use the percentage formula? Can you imagine how confusing that would be? And that's why med math is so confusing for a lot of people. Today, I want to simplify this and I want to show you what I actually use in real life. I've been in healthcare now for 26 years. So, my career, for those of you who don't know, I was an EMT. EMT intermediate is where I started. Then I became a paramedic, then a level 2 instructor, a level 3 instructor, a certified flight paramedic, went to medical school, and now I'm finishing my doctorate to be an emergency physician. So I've had to do a lot of drug calculations over those years. But what I actually use every single day is what I'm going to show you, what I've used for so many years. It works every time. It's always reliable. It's simple, and I can always get to the right answer. And that's what I'm going to show you today. Okay? Everybody's still with me. So I want to introduce this topic called dimensional analysis. I started talking about it last week, but let's talk about what it is. And I want to kind of segue it or analogize it to traffic. How many of you have ever been, let's say, a place like Chicago, Atlanta? And okay, so let's say you're in, let's just use Atlanta as an example. Let's say you're over here and you've got, this is your expressway. And you've got all these different lanes, right? We're just going to act like those are dash lines that you can cross. So let's say you're over here in the fast lane, in the express lane. But suddenly you realize, oh man, I've got to hurry up and I got to exit off because my exit is over here. Well, would you just go from here immediately to here? Like, would you just change that many lanes that quickly? Hopefully not, because that could be really dangerous. Well, that's kind of how it is in medicine with drug calculations. So over here in the fast lane, this is kind of what you have. Like this is your order. This is your order. Okay? But over here on your exit, this is what you want. This is where you want to end up. Okay? But what we have to do is we have to just kind of systematically, one lane at a time, we have to change these lanes to eventually get to the lane where we want to be. Does that make sense, everybody? Okay, so that's how I want you to think of it. Now, what is this concept of dimensional analysis? You know how I just showed you we have all these different formulas to know, but there's got to be a better way, and that's what I want to introduce to you. So here's our little roadmap, okay? So let's say we are going from here to here. Now, this is our little roadmap that we can follow to get us from wherever we're trying to go. So let's say from point A to point B. This is the roadmap that we'll follow. And this little simple roadmap we can follow every single time with any kind of drug calculation. Now, would you rather know one system or would you rather memorize 18 formulas? Type in the chat. Let me know. Would you rather know 1 or 18? Give me a 1 or an 18. So give me a 1 or 18. Come on, where are my 18s? Okay, so everybody said 1. You'd like to know one system, and that's what we're going to talk about. Now, to introduce this whole concept of dimensional analysis, here's the idea. Here's the big picture up front, okay? So let's say they want you to have, let's say you have a drug that's given in milligrams. So they give you a drug in, let's say, milligrams, but you need to figure out how many milliliters do I draw up to give to the patient. Or let's say they give it to you in micrograms and you need to figure out milliliters per hour. Or let's say they give you micrograms per kilogram and you need to figure out drops per minute. Or let's say they give you micrograms per kilogram per minute and you need to figure out drops per second. Okay? So now, first of all, you have to understand these abbreviations. So MCG, that's going to be microgram. Is somebody sharing your screen? Okay. All right. So MCG, that's going to be micrograms. KG, that's kilograms. Minutes, we have milligrams, we have milliliters, hours. GTT is drop, or sometimes you'll see GTTS for drops. Then we have seconds. Okay. So you definitely need to understand your units. For instance, gram is a lowercase g, but GR is for grain. Okay, so that's if we're measuring solids, for instance. Make sure that you don't mix up grain and grams. Now, I think you get the idea, but here's this whole concept. Let's say if I'm going from micrograms, let's say I'm going from micrograms and I need to ultimately end up in milliliters. Well, here's the idea. Every time I have a unit, let me start this over so that you see exactly what I'm doing. Here's what I'm gonna do. I'm just gonna draw a horizontal line. And then I'm gonna make, you know how a cat has 9 lives, they say? So we're going to do 9 lines. So 1, 2, 3, 4, 5, 6, 7, 8, 9. So all I did is I took a horizontal line and then I made 9 quick vertical lines. Now, this is going to give us some room to work. We're not going to need every one of these boxes in every calculation. However, I've already worked out hundreds of problems, and I'm going to tell you that this system will work for every situation because it gives you room to work if you need those extra boxes. Now, so let's say we start off in milligrams, and we want to ultimately end up in milliliters. Okay, well, here's the idea. Here's the big picture idea. Anytime that we need a unit to go bye-bye, if we need to get rid of it, we need to hide it. We need to bury it below, okay? Now, we could go a lot of different ways there, but I'm talking about drug calculations. So anytime we need to hide something, we've got to bury it. We've got to put it down below. So let's say if I need to get rid of milligrams, the only way I'm going to be able to get rid of them is, see, right now it's up top, but I need to put it down below and I need to hide it. And so now I can have milligrams in the bottom. Or let's say I have minutes. The only way I can get rid of minutes is I've got to put it in the bottom. Let's say I have hours. The only way I can get rid of hours is I have to put it in the bottom. And so every time I have one combination where I have the unit in the top and that same unit in the bottom, now I can just cancel out those units. And I'm only left with numbers, okay? So here I can cancel out minutes and minutes. I can cancel out hours and hours. And what I'm left with is milliliters, okay? Now, we're going to do a lot of examples of this, so you're going to see this pattern over and over and over. Here's the big picture, though. Once again, anytime I have a unit, to go from one unit to another, remember, I can't just go from here. I can't go from the express lane all the way to my exit in one move. I have to just kind of incrementally make little steps to eventually get to where I'm trying to go. Is everybody good with that part so far? For most of you, you're familiar with at least this part, okay? So now there's another thing I want to introduce here. This concept of start, flip, cancel, solve. So just 4 simple words: start, flip, cancel, solve. So whatever we start with, sometimes you have to flip the relationship. I'll show you what I mean. The reason we're flipping things is so that things can cancel out and then we can solve the problem. So let me give you an example. Let's say you have 4 milligrams in 250 milliliters. Well, if I wanted to get rid of, let's say I want to get rid of milliliters and I want to end up in milligrams. Well, remember, the only way I can get rid of something is I have to find a way for it to end up in the bottom. So let's say, or here, in fact, since I wrote it this way, I'll use my original example. So let's say I want to end up with, I want to be able to get rid of milliliters. So if milliliters starts in the top, the only way I can get rid of it is milliliters has to end up in the bottom. Okay? Now, so what I want you to see is if I write it 250 milliliters and 4 milligrams, whether I write it as 4 milligrams on the top or 4 milligrams on the bottom, they are the exact same relationship. Okay? So for instance, let's say you have husband and wife. Whether I write it as husband over wife or wife over husband, it doesn't really matter. That's the exact same relationship. Does that make sense? Okay? So what I'm saying is sometimes you need to flip these situations around, flip which one is on the top or which one is on the bottom, so that ultimately we can cancel something out. And this is going to make a lot more sense as we go on, and we'll put some actual numbers in there. Okay? Now, so let's start off with some easy stuff. Now, what I want you to do, in fact, let me just put this back. For those of you who joined us a little later, I'm going to put this back in the chat for those of you on Zoom. You can follow along with me. I've dropped that in the chat for you. So let's go ahead and start with some easy ones. We're going to take this first one. So we're going to convert 1.75 grams. So we're starting in grams and we want to end in milligrams. Now, how can I get grams to cancel out? Right now, grams is in the top, so I have to get grams in the bottom in order for those units to cancel. So now, since I have grams in the top, I'm going to put grams in the bottom, but ultimately, I'm trying to end up in milligrams. Okay, notice here, I have milligrams here and milligrams here. So, is there a relationship between milligrams and grams? Yes, we know that 1 gram is 1,000 milligrams. So now, all I have to do is I cancel out my units, grams and grams. They're going to cancel out. I'm only left with milligrams, which is what I wanted. So I started with something. In this case, I flipped it to where grams is on the bottom. Then I cancel, and now I'm going to solve. So I just do 1.75 times 1,000. And what do you get? I want you to do it all with me. What do you get on this one? So what do you get? All right, so you should get, 1.75 times 1,000. Remember, that's the same as moving this decimal 3 places to the left, or to the right. That's going to be 1, 2, 3. And I'm going to be left with 1,750 milligrams. So 1,750 milligrams, that's my final answer there. All right, that was pretty easy. Let's do another one. All right, and we're going to do several today, and we'll get through as many as we can. And then I will also give you my worked out answers where I've already solved everything. All right, so let's do another one. We're going to start off with 0.6 milligrams, and we want to end up in micrograms. Okay, so right now, milligrams is in the top. I'm going to put it in the bottom so they cancel out. Now, is there a relationship between milligrams and micrograms? Yes. 1 milligram is 1,000 micrograms. So now my milligrams cancel. I'm left with micrograms, which is exactly what I want. So that means that I'm in the proper units. So now just multiply 0.6 times 1,000 and tell me what you get. And while you do that, I'm just going to pull up another deck really quickly. All right, type that. Okay. All right, good. So yes, we've got 600 and 600 what? What's our final answer going to be? All right, we always need to put the units. So 600 what? 600 micrograms. Good job. All right, now hang on just a minute. Let me just pull up another deck on my screen. Bear with me one moment. Okay. All right, because I'm gonna pull up something else to show you at the end, especially when we get to these epi drips. I went ahead and drew out some cool pictures. I think you're gonna like it. All right, now let's go back to this one. So we ended up in 600 micrograms. Okay, good. All right, we're easy so far. Now, the other thing I want you to know here is notice what I'm doing to get these numbers. All the numbers in the top, I'm going to multiply by all the numbers in the top. Now, what I want you to do is I want you to let's keep it simple, especially if you're going to be putting this in your calculator. Literally just take this number times this, times this, times this, times. Just multiply by every number on the top. And then we divide by every number on the bottom. So it's going to be times, and then divide by. Now, yes, I understand that you can simplify, you can reduce numbers, but that's an extra step. If you're putting numbers in your calculator, just put the numbers in the calculator. It's less room for error, okay? And if you will do it this way, you will get the right answer every single time. All right, so let's keep going. Let's do our next one. Let's make that bigger. So now this one, we have a patient's weight. Okay, so in this situation, we have a patient's weight. All right, hang on one second here. Just making sure I can see everybody at the same time. All right, good. So in this one, we have a patient's weight. So We have a patient's weight of 242 pounds. Now, pounds is in the top right now. In order for me to, let's see. Oh, okay. Hey, for whoever on YouTube, I like your idea. Somebody said that you could actually make kind of a paper notebook that has this graphic on it, um, and use it as like a some kind of laminated thing for people to use in the rain. Absolutely. In fact, I'm going to show you something at the very end that will solve exactly that situation. So let's get back to this one. So we have a patient who weighs 242 pounds. Right now, pounds is in the top. How do I get rid of pounds? Pounds has to ultimately end up where? You can just come off mute. Just come off mute
Put
for me.
2.2 in the bottom.
Okay. So, well, first of all, so I have pounds in the top. I don't have a 2.2 yet. So I can't just put a 2.2 randomly. I see where you're going. But right now, all I have is pounds. So I have to put pounds in the bottom. Now, there is a relationship from pounds to kilograms. In fact, that's what they want us to do. They want us to end up in kilograms here. So is there a relationship from pounds to kilograms? Yes. 1 kilogram is 2.2 pounds. Okay. And that's exactly what Monica just said, that we're going to put 2.2 pounds in the bottom. But I want you to know where all these numbers are coming from. If you ever get confused between, okay, does the 2.2 go with pounds or kilos? Always remember, all right, so there are some people out there in the street that say things like, oh, I have 1 kilo of something. So we're always going to put 1 with kilo. So we have 1 kilogram and 2.2 pounds. Now, in this situation, that's all I have. This is only where I'm converting from pounds to kilograms. In this case, pounds cancel. And remember, we multiply times everything across the top. We divide by everything in the bottom. So in this case, whenever you see a 1, we can just ignore it because the identity property says 1 times anything is that number. So we can just ignore the 1s. In this case, I'm simply going to do 242 divided by 2.2, and I'm going to be left in kilograms. Now, in this case, I'm left in kilograms, and I want to be left in kilograms. So those match. What's my answer? So just go ahead and divide that for me. So do 242 divided by 2.2, and tell me what you get.
110.
All right, so you're going to get 110 kilograms. All right, good. Let's keep going. Now, let's change gears a little bit. So we were just doing simple conversions. Now we're going to kind of say, okay, what happens if you need to give somebody a pill or a tablet or a capsule? So in this case, we have an order for, and I want you to always just kind of start with where you start. And the starting point is typically going to be our order. Now, sometimes if it's weight-based, I will just start with the patient's weight in pounds or weight in kilograms, okay? In this case, the order is for acetaminophen, so Tylenol, or paracetamol for my family outside the U.S. They have an order for 975 milligrams PO. What does PO mean? PO means per oral, so by mouth. What is NPO? If they say, hold on, keep this patient in PO. Okay.
Nothing by mouth.
So that's nothing by mouth. So keep them in PO. They're going into surgery or whatever. We don't want them to have anything by mouth. So nothing by mouth or nothing per oral. Okay. So in this case, they say, given they have an order for 975 milligrams of acetaminophen, but this tablet comes in 325 milligrams. So in this case, we're going to say, notice I have milligrams in the top to get rid of milligrams because the question is how many tablets. So my answer should be some kind of number plus tablet. So to get rid of milligrams, I'm going to put it in the bottom so it can cancel. And what do I have? I have 325 milligrams and 1 tablet. Okay. In fact, that's actually how we would write 1 tablet. But let's just say, like if we're doing a written prescription, but let's just put a number 1 there. Oh, well, 1 tablet. Because I want to end up in tablets. So now I have tablets and tablets. Those match. So I'm in the right units. We're going to cancel out milligrams and milligrams. I simply multiply it times everything in the top, divide by everything in the bottom. In this case, we can ignore the 1, and it's simply 975 divided by 325. And how many tablets do I end up with? How many tablets? So that's just 975 divided by 325, and that's going to end up with 3. So my answer is going to be, I'm going to give them 3 tablets, 3 pills. All right, let's keep it moving. All right, let's do another one. This one is, we're going to give prednisone. So we're going to give a corticosteroid, so 45 milligrams PO. But they want to end up in tablets. I need to figure out how many tablets. In this case, 45 milligrams. I have milligrams in the top. We're going to put milligrams in the bottom. And they're saying that each tablet, so 1 tablet is 10 milligrams. In this case, I have a milligram in the top, milligram in the bottom. I'm left with tablets, which is what I want. Those match. Just divide 45 by 10. And what do I get? I get 4.5 tablets. So how do I give a half a tablet? Well, you just cut it in half, okay? Or just break it in half. Use a pill splitter. In that case, we're going to have 4.5 tablets. Now, in this case, let's do another one. And make sure everybody is commenting in the chat. So if you're on YouTube, if you're in Facebook, wherever you are, make sure you're putting your answers there with me, just so that I know you're understanding. Okay, let's keep going. In this case, we have an order for an antibiotic. So this patient has some kind of bacterial infection. We need to give him an antibiotic. Okay, Billy's getting a call, no problem. You'll be able to catch this in the replay. And Billy's actually getting ready to test for his paramedic. So everybody, we're going to wish him well. We'll send up a prayer for Billy. In fact, let's just go ahead and do it now. So Father, I just thank you right now. I come to you as humbly as I know how. We just ask, well, first of all, we just come to you with thanksgiving in our heart, thanking you for everything that you've done. Father, we know that Billy is getting ready to test on his 6th attempt for the National Registry Paramedic exam. He has put in the work. He has done the time. His learning, his knowledge has grown by leaps and bounds. We ask that you just calm his mind. We ask that you just comfort him. We dispatch your ministering and warring angels ahead of him to protect him, to guide him, to lead him, to direct him. And Father, we just thank you for the victory in advance. We thank you for everything that you've done, everything that you're doing, and everything that we know you'll continue to do. We just give you the praise, all the praise, the honor, and the glory. In Jesus' name we pray. Amen. All right. So didn't know we were going there, but hey, so Billy, we wish you well. And I'll probably talk to you a little later today. All right. So let's get back to this. We have amoxicillin. We have an order for 1,000 milligrams, and they want capsules. We want to end up in capsules, okay? So in order for us to get rid of milligrams, these milligrams have to cancel. So let's put milligrams in the bottom, and we have, let's see, each capsule. So 1 capsule contains 250 milligrams. We have milligrams in the top, milligrams in the bottom. I simply divide 1,000 divided by 250, and how many capsules is that? So 1,000 divided by 250 is 4. So we're going to give them 4 of these capsules. So 4 pills there. Okay, let's keep going. So how's everybody feeling so far? Is this kind of simple? So far, so good. Hey, Monica. Monica is actually. It's my understanding that you have a background in pharmacy. You care to tell us about that? Is that something you can talk about?
No, I don't have a background in pharmacy.
Oh, okay. I was thinking, well, somebody in our community mentioned they had a background in pharmacy. Oh, I think it's Angela. I'm sorry, it's not you, Monica.
No,
I
you're
believe
okay.
it's Angela that said she had like 20-something years in pharmacy. So I was like, oh man, I was thinking it was you, but I just remember it's Angela.
No, not me.
Not a problem. So let's keep going. We're going to talk about some, and I may not do every single one of these examples, but I am going to do at least an example out of every category, just in the interest of time. Is everybody learning so far? For those of you on YouTube, Facebook, Zoom, wherever you are, let me know that you're learning. On Zoom, just use that reactions. Give me some fire emojis. Give me something. Let me know that you're with me. Let me know you're following me. All right. Monica says yes. All right, let's go. In this case, we have an order for acetaminophen again. So we've got some more of this. Man, we're handing out Tylenol left and right today. So we're going to go ahead and give them, we got to watch this Tylenol because too much Tylenol can put them into fulminant hepatitis. We can destroy their liver really quickly. So we've got to be careful not to overdose people on Tylenol or not to take too much Tylenol or acetaminophen or paracetamol ourselves. All right, now let's keep going. So they want us to give, we have an order for 640 milligrams PO of acetaminophen. And we want to end up in milliliters. They want to end up in milliliters. Now, you notice how I keep following the same roadmap. I always start with whatever I start with, and I always end up with wherever I'm trying to go. I may or may not use all these spaces, but that's okay if you'll just do this every single time. Now, on the workbook, I've already put the lines in for you, but let's say you don't have lines. All you're going to do, we're going to do a horizontal line, 9 lines down, 1, 2, 3, 4, 5, 6, 7, 8, 9. And there's our roadmap. So let's go back to this one. We've got 640 milligrams of acetaminophen. Now, we have milligrams in the top, so I got to put milligrams in the bottom. That's the only way I'm going to get rid of it, because ultimately I need to end up in milliliters. Now, they tell me that the medication is supplied as 160 milligrams. Okay, so I have milligrams and milligrams, so I'm going to put 160 there. And 5 mLs. So that means 5 milliliters. Now I end up with milliliters on top and milliliters on top, which is exactly what I want. So now my milligrams and milligrams are going to cancel. Now, how do I do these numbers? Remember, because previously we had a 1 here, but in this case I have a 5 here, so I can't ignore it. So in this case, I just simply multiply times everything on the top. So I'm going to do 640 times 5. I don't even have to hit equal or anything. I can just do 640 times 5 divide by 160. Okay, so 640 times 5 divided by 160, and what do I get? What's my final answer going to be? Somebody says they actually carry a battery calculator. Hey, no problem. Okay. Now, somebody asked the question, so could you divide these things first and then multiply times something else? Or could you, let's say there was a number here, could you just do this one, do this top number divided by bottom number and then times this? You could, but I'm going to tell you what I want you to do is I want you to simply multiply every number across, divide by every number in the bottom. And the reason for that is you're less likely to make a mistake. Okay. If you'll literally just follow the roadmap, this times this times this times this times this, divided by, it will work every single time. Okay. Now, yes, once you get more experience, once you've been doing this, you'll kind of do it your way. But I have 26 years of experience and I do it this way every single time. This is also something that we learned in chemistry. So in stoichiometry, where you're having to balance chemical equations, because some of these equations are so long that if you start like skipping steps or like reducing things too soon, you have a lot of chance for error. So the way I'm telling you is the way that is guaranteed to work every single time. Okay. In this case, our final answer ended up in 20 milliliters. Okay. Any questions so far? Are we good? All right, let's keep it going. Okay, now, so here's another one. This is a similar example. So we have 750 milligrams of amoxicillin, 750 milligrams, but they say how many milliliters? I want to end up in milliliters. So now, in order for milligrams to cancel, it's got to end up on the bottom. So I'm going to put milligrams there. Notice the same pattern over and over and over. I'm going to put milligrams there. And they say that this medicine is supplied 250 milligrams in 5 mLs. Now, let me back up for a second. So what if I wrote it just like it is, 250 milligrams in 5 mLs, 250 milligrams in 5 mLs? Yes, that is the equivalent. However, in that situation, I have milligrams in the top and milligrams in the top. I can't cancel the milligrams in that situation. The only way for me to cancel them is I have to have one of that unit in the top and that same unit in the bottom. So in this case, I can't cancel anything because if I multiply milligrams times milligrams, what I end up with is milligrams squared. What? So now I'm going to give milligrams squared of something. What does that even mean? Like, how do I do that? So in that situation, I cannot, so we have to flip these around. So I have to put the 250 milligrams in the bottom and the 5 milliliters in the top. That's the only way for my milligrams to cancel. In that case, I'm just going to do 750 times 5 divided by 250. Now, here's something else that a lot of people will do. You'll see, okay, there's a relationship between 750 and 250. So sure, you could change this to a 3, and you could change this to a 1. There again, we're introducing more chances for error. So what I would rather you do is just leave the numbers alone. So we're just going to put that as 750 times 5 divided by 250. And what do I get as my final answer there?
15.
Okay, I'm going to end up with 15. So I ended up in milligrams cancel. I ended up with milliliters, which is what I want. And my answer is 15 milliliters. Okay, let's keep it up. We're going to skip 9 because it's exactly the same way as the other ones. Let's go to a different kind. So in this one, on number 10 here, we're now drawing up a medication from a vial or an ampule. And this is something that you're going to do a lot of the time in EMS or in healthcare in general, whether you work on a floor, whether you work in the ED, the ICU, CCU, anywhere. If you work in a critical care transport environment, this is something that you're going to use often. So let's go back to this one. We're drawing up a medication from a vial or an ampule. Now we're starting off with simple stuff just to show you the patterns, and then we're going to ramp it up with more complex calculations. In this case, you have an order for ondansetron, so Zofran, a 5-HT or serotonin receptor antagonist for nausea, an antiemetic for nausea. In this case, the order is for ondansetron 6 milligram, which is different. Typically, it's 4 milligrams, but in this case, the order is 6 milligrams. So, but we want to end up in milliliters. They say how many ml should be drawn up. Remember, I can't just go from here to here. I've got to change lanes. So we're going to go from here, but right now I have milligrams. So what am I going to do? I'm going to put milligrams in the bottom. So I have milligrams in the bottom, and they say I have 2 milligrams. So I'm going to put the 2 here. And then whenever there's no number in front of the unit, we understand it to be 1. So that's kind of like me putting a 1 here and saying 1 ml. So that's 2 milligrams in 1 ml. In this case, I ended up with milliliters in the top. I want to end up with milliliters in the top. Everything's looking good. So remember our little thing we say? We start, hold on. We start, we flip, we cancel, we solve. Okay? And this is just something I came up with. We start, we flip, we cancel, we solve. So we started with our 6 milligrams. We flipped them so that we end up with 1 in the top, 1 in the bottom. Now we're going to cancel out what we can. And now we're left in milliliters. So we just simply solve. In this case, I have 6 because 6 times 1 is 6 divided by 2. 6 divided by 2 is 3. My answer is going to be 3 mLs there for number 10. Everybody good so far? Let's do another one. In this case, I have an order for, I want you to make sure you're doing it with me. I have an order for 100 micrograms of fentanyl. I said last week, it's pronounced fentanyl and not fentanyl. There is no O in fentanyl. Okay? So regardless of what the news media and the politicians say, we don't have a fentanyl crisis. Fentanyl, maybe, but it's fentanyl. Okay? So we have 100 micrograms of fentanyl. We want to end up in milliliters. Right now I'm in micrograms, so I need to put micrograms in the bottom. That's the only way it's going to cancel. In this case, my vial contains 50 micrograms in 1 milliliter. In that case, micrograms cancel. I'm left with milliliters, which is what I want. It's simply 100 divided by 50. What am I left with? I'm going to be left with 2 milliliters. Now, let's bring somebody in. Who can turn here? Monica, since I saw you, let's go ahead and bring you in for a moment. And I want you to do the next one for me. You there? You ready?
Sure.
All right. And then Brian and Cody, I need you to turn on those cameras so I can see those handsome faces. And then I want you to take the next one. All right, Monica, let's go. We're going to go to, let's do number 12 together. Okay. In this case, we have an order for epinephrine 0.25 milligrams IM. Okay. So this is probably an anaphylaxis situation for a kid, maybe. So we have an order for 0.25 milligrams. I want to end up in what?
Milliliters.
I want to end up in milliliters. Okay. So how am I going to cancel out milligrams?
You're going to put 1 on the bottom.
Just a 1?
And ml. Well, 1 milligram on the bottom.
Okay, so hold on. Let's do it a step at a time. So the way I cancel out milligrams is I put milligrams on the bottom. Okay. Now in this case, they tell me that I have 1 milligram and 1 ml. So I'm going to put a 1 milligram and 1 ml.
Yep.
In this case, I end up with milliliters. I want to end up in milliliters. Those two match. I'm going to cancel out my milligrams. And so that's simply 0.25 times 1 divided by 1 is 0.25, right? Would you agree? Would you agree?
Yep.
Okay. Yep. Okay. So we're going to do another one. Now, I want to keep you there with me, and we're going to go to the next one, Monica. So in this case, we have, this is a weight-based medication. So this is very common. It could be an adult or pediatric dose. Obviously, a lot of kid doses, a lot of pediatric dosages are weight-based. You think of, let's say, cardiac arrest. It's going to be 0.01 milligram per kilogram. But let's say if you're dealing with something like lidocaine in an adult, it's still weight-based. It's 1 to 1.5 milligram per kilogram for the first dose, or 0.5 to 0.75 milligram per kilogram for the second dose. Okay, so there are weight-based drugs for adults and peds, so you still need to know how to do it regardless. All right, let's keep going. So in this case, so Monica, so now we're going to use more boxes in this case. We got to make more lane changes because in this situation, we start off with 176 pounds. And they want me to end up in what?
Kilograms.
What does the question ask? They want
how many milligrams? Yes, sorry.
Okay, so in this case, they say how many milligrams. So I need my final answer to be in milligrams. So I need something over here somewhere to end up ultimately in milligrams. Now, how am I going to get rid of pounds? Because I got to go from pounds and make these lane changes to eventually get to milligrams. How do I get rid of pounds? Right now it's in the top, so where am I going to put it?
You're going to have
pounds
to put
is
it
in the top, where am I going to put it?
I would say on the bottom.
Stop right there.
This is where I would struggle with this one because I would just do the automatic.
So how about this? We're just going to put pounds in if we'll follow the roadmap, we're going to always end up in the right exiting off, okay? So in this case, pounds started off in the top. We're going to put pounds in the bottom. Now, in this case, I can't go from pounds to milligrams, but I can go from pounds to kilograms. Oh, nice. We already said that we're always going to put a 1 by the kilo. So we have 1 kilo, and that's going to be 2.2 pounds. Now, right now I'm in kilograms, but I need to end up in milligrams. Right now, kilograms is in the top. How do I get rid of it? Whenever I need to hide it, I got to bury it underneath. So we're going to put kilograms in the bottom now. And what goes in the top?
1.
What goes right here? If I have kilograms, forget the numbers right now. Let's deal with the units. So if I have kilograms, what do I have here?
Kilogram.
If I have kilograms in the bottom, what am I going to put in the top? What kind of relationship am I forming here? Because remember, I'm trying to end up in milligrams. Right now, I'm in kilograms. So I got to do something to get me to milligrams. So what's going to end up here? That's going
you're going to put 0.2.
Okay, always start me with the unit because what I'm trying to do is cancel units.
Okay.
So 0.2 is a number, but I want a unit. So right now I have a unit called kilograms, and I need another unit here. What's that unit going to be? This unit is now going to be milligrams. And now I fill in the numbers. And the reason I want you to do it this way is this is going to work every single time at 3 o'clock in the morning when your brain is tired. So in this case, is there a relationship between milligrams and kilograms? Yes. We know that 1 kilogram is 1,000 milligrams. So now I have all my units and now I have numbers. In this case, I end up in milligrams. I want to end up in milligrams. Those two match. Now I can cancel my units. Pounds and pounds, get rid of them. Kilogram and kilogram, get rid of them. Now the only thing I'm left with is milligrams. So simply do 176 times 1,000 divided by 2.2. And what do I get? Type it in the chat. What's my final answer there? Oh, wait a minute. In this case, no, I'm sorry.
No,
that's not what I should do because they're not, I forgot we didn't add the medicine here. In this case, what's going to go here is, I overlooked this part. In this case, they actually give me something with milligrams and kilograms, so I don't even need a conversion there. I just plug in the numbers.
So that's where we need that
0.2 milligram in 1 kilogram. So in this case, I'm going to multiply 176 times 0.2 divided by 2.2. That's how it should be. I totally overlooked the medication.
Yes.
Okay, and now what's 16. My final answer? I still end up in milligrams. I want to end up in milligrams. What's my number?
16 milligrams.
16 milligrams. That's my final answer. Okay, and I apologize for that. But this is why you want to always do it stepwise. It prevents things like that from happening, and it also helps you quickly identify mistakes. Okay, let's do another one. Monica, we're going to have you do one more, and then I see Evelyn came in with us. Maybe she'll turn on the camera also. Okay, let's keep going. Monica, we have 154 pounds. Now, let's not forget the medication order. Okay, now I want to ultimately end up in what unit? What's my final destination?
Micrograms.
Micrograms. Okay, right now I'm in pounds. I got to make some lane changes to get me to micrograms. So right now I have pounds in the top. Let's put a pounds in the bottom. Just follow me here. Now, well, I can't go from pounds to micrograms, but I can go from pounds to kilograms. Okay, what's the relationship? 1 kilogram is 2.2 pounds. Right now I'm in kilograms. Okay.
Yep.
But they give me something in micrograms per kilogram. Okay. Now, in this case, do micrograms go on the top or do micrograms go on the bottom here?
On the top.
Why?
Because that's what we want.
Nice. And what we want always has to end up on the top. And what we're trying to get rid of always has to end up on the bottom. So in this case, in order for me to get rid of kilograms, I've got to move it to the bottom. So we're going to put the kilogram part on the bottom. There's my kilogram part. And we're going to put the microgram part on the top. And now let's just plug in my numbers. I have 1 kilogram. I have 1.5 micrograms. I end up in micrograms. I want to end up in micrograms. Those two match. Let's cancel my units. Pounds, pounds, bye. Kilograms, kilograms, get rid of them. I'm left in micrograms. That's what I want. Let's just solve it. In this case, I end up just doing my math. 154 times 1.5 divided by 2.2. What do I get?
One way, I don't think my math was right.
Okay, so do it again.
It was 154. 154 times 1.5
1.5
divided by 2.2 is 105
equals
micrograms.
105. That sounds right. 105 micrograms. That's my final answer. Okay, now this time, Monica, how do you feel about that?
That was much better. It was a lot easier after it was just simplified.
Oh,
It,
wait a
it
minute.
seemed too
Whoa
easy for
now.
me.
Okay. All right, good. So this time,
It was
Monica,
easier when it was simplified and just following it.
okay, hey, not a problem. And see, the thing about the roadmap is I don't have to think so much, right? I don't have to worry about like
Right.
all this extra stuff. I don't have to worry about memorizing formulas. I just like it's pretty simple for me. And I'm not a dumb guy. I'm a pretty smart guy. But at 3 o'clock in the morning, I may
Yeah.
not be as sharp. But it's very easy for me to say, yep, cancel, 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 multiply, divide. I can do that. Okay. Now, for those of you on YouTube, how are you feeling so far? Is this like, are you enjoying this? Is this making sense? Okay, now I want everybody on YouTube, Facebook, or Zoom. I want everybody participating. Now, Monica, on this one, I want you to talk me through the steps. Okay, so on this one.
Okay, so we're going to put the 220 pounds up on the top left.
I mean, she's ready. I don't get a drink of water, nothing. Let's go. Okay, so talk me through. Let's go.
Okay, 220 pounds on the top left.
Nice. Keep going.
And then because we need to convert it, we're going to put 1 kilogram on the top and
Hold on.
2.2
I want you to do it in the order I'm telling you every single time.
Yeah, so we need to put pounds on the bottom.
There we go. And why?
So we're going to do
because right now, if I
2.2.
just put kilograms, I have nothing to like, there's nothing I can cancel out. So the reason I'm telling you to do it in this order, yes, the answer is going to be the same. I get it. But I want you to just follow the roadmap every single time because we got to make these lane changes. We're going to go from pounds to pounds.
Sure.
Now, we're going to go from pounds to
kilograms.
Kilograms. Is there a relationship there?
Yes, 1 kilogram and 2.2 pounds.
Okay. Now I have kilograms, but I want to end up in what?
You want to end up in milligrams.
Is that what it says?
Oh, milliliters.
Aha.
Yeah, good shot. Good call.
Okay. And that's why I want to draw out my roadmap. So I want to end up in milliliters. Right now, I'm in kilograms. So that means I have to make some more lane changes. I can't go from here to there. I got to make some more lane changes.
Sure.
So now I have kilograms. What am I going to do to get rid of it? Anytime I want to get rid of something, I got to hide it. Where do I hide it? Under the bottom. So where does kilograms go?
Sure. On the bottom.
Put kilogram in the bottom. Now I got to get some kind of way to milliliters. Tell me what's next.
Then you're going to put 0.4 milligrams on the top and 1 on the bottom with the kilogram.
Okay, so now that took care of my order of 0.4 milligram per kilogram. I got that part, but now I'm still not, because what unit am I in right now?
Right now you're in milligrams.
Am I done?
No.
No, because I need to end up in milliliters and these two don't match. So I got to do some more steps. Okay, well.
Sure.
I got to do
now you're
something
gonna
with this. So I have 20 milligrams in milliliters. Which one goes on the bottom?
So we want a milliliter on the top. So we'd put milliliter on the top.
Okay, but I asked which one goes on the
that's
bottom.
What we want. Oh, milligram.
Okay, I know it seems nitpicky, but if I do it this way every single time, I always get the right answer because I have milligrams in the top.
Milligram goes on the bottom.
Let's put milligrams on the bottom and then what goes on the top? That's going to be my milliliters. Plug in my numbers. Where does the 20 go? Top or bottom?
So the 20 is going to go on the bottom.
Okay. What goes with the mLs?
And 1 will go on the top.
Okay, now I end up in milliliters. I want to end up in milliliters. These two match. So now I should be done. Now let's get rid of what we can. Pounds, pounds, kilograms, kilograms, milligrams, milligrams. Now I just solve. So tell me, what are we going to multiply and what are we going to divide?
We're going to multiply everything on the top. So 220 times 1.
Okay, and we can ignore all the ones.
0.4.
So just tell me the numbers we're going to put in our calculator. We're going to do 220 times
0.4.
And I want you to say that as 0.4.
0.4 milligrams.
Come on, coach.
You're good.
The reason for that is especially when we're writing, we never want to confuse like 4 and 0.4. So we always put the leading 0. We just don't put the trailing 0. So we're going to do 2.2. I'm sorry. See, I'm doing it now. We're going to do 220 times 0.4 divide it by 2.2, divide it by 20, and what do I end up with?
2
2.
milliliters.
Boom, just like that. So I took all this stuff, and if I just follow the roadmap, boom, I get my answer, just like that. And that was too easy, right? How was that, Monica?
Yes.
Pretty good.
I liked it.
All right.
Yes.
Hey,
thank you.
let's give you a break for a moment because you're getting tired of me.
Perfect.
Oh,
That's
well,
on.
wow. She said perfect. So let's go to Brian or Cody. Can I get one of you to turn on your camera so I can see you? And hey, Brian, how you doing?
How are you?
I'm well, sir. So let's do this next one. All right. So here you go. We got a pediatric dose. All right. So you're going to walk me through every step. Remember, we're going to start with wherever we start. We're going to end up with wherever we're trying to end. To go, I always have to cancel out the units. So notice I always go to the bottom first, then the top, and I plug in the number. Then I go to the bottom, put on the top, I plug in the number. Then I go to the bottom, plug in the top, put in the number. Bottom, plug in the top, put in the number. You see the pattern? And we just do it all over and over and over again. So you're going to take me through this one. Let's go. We have a child that weighs. Brian,
Gonna be on the
say it again. Talk back to me.
Can you hear me?
No. Say it again. Just talk.
Hear me?
Yes. So yeah, but just talk for me. What do I start with? Okay.
Be on the top.
So we have 33 pounds. What goes in the bottom?
Pounds.
Pounds. So let's put pounds in the bottom. Now there's a relationship between pounds and kilograms. 1 kilo is 2.2 pounds. Now I have kilograms, but what am I trying to end up with?
The milligrams.
I need to end up in milligrams. Right now I'm in kilograms. So that means I need to keep going. I have kilograms in the top. What do I do with it?
Kilograms in the bottom.
Let's put kilograms in the bottom. So what goes in the top? Okay. So in this case, I have a medication order of 10. So I'm going to put milligrams here. And this is in milligrams and kilograms. So now I have milligrams and kilograms. I put the 10 where it belongs so that I have 10 milligrams and 1 kilogram. Now I end up with milligrams in the top, and I want to end up in milligrams in the top. Those two match. So what do I do next?
Multiply the top.
Well, first of all, because that's my last step. First, let's go ahead and cancel my units. So let's cancel pounds and pounds, kilograms and kilograms. I'm only left with milligrams, which is what I want. My units match, so now I can solve. So now I just solve, and let's do it. So tell me what am I going to multiply and divide?
By the 33 pounds times the 1, which is going to be
okay.
33.
We can ignore the 1 because anything times 1 is going to get us that same number. That's the identity property of math, or identity property of multiplication. So ignore the 1. So we're going to do 33 times 10, divide by 2.2. And what do I get?
2.2, and I got 150.
That sounds, yeah, that sounds right. So 150 milligrams. That's my answer. Let's do another one, Brian. Now I want you to have a little more confidence. Okay. So walk me through step by step how you're going to do this.
44 pounds. I'm going to put 44 pounds on top, and then the pounds is going to be at the bottom. And then what it's asking me is how many milliliters should be administered. So I'm going to put ml all the way at the end. And then it says the medication is 0.1 milligrams over kilogram.
Okay.
Medication is
Okay, so right now I have pounds. What goes here? Because I got to go from something to eventually get to milliliters. Right now I'm in pounds, but what number goes in the top? Because I don't want my weight to be in pounds. I need my weight to be in what? Because the medication is milligrams per kilogram and not milligrams per pound. So what unit goes right here? Okay, look at the example right before it. Notice how I started with pounds and I put pounds in the bottom and kilograms in the top. I'm going to do the exact same thing here. And let's put them both on the screen so you can see the pattern. I go from pounds to pounds, so pounds to pounds. Then I put kilograms in the top, so let's put kilograms there. Now, is there a relationship between kilograms and pounds? What number goes in front of kilograms?
1.
1. What number goes in front of pounds?
Pounds, 44 pounds. So
No,
that would be
right now, what number goes here? Because what's the relationship between kilograms and pounds? Okay, so 1 kilogram is 2.2 pounds. Okay, now I have kilograms, but remember I'm trying to end up in milliliters, so that must mean these two don't match, so that must mean I got to make another lane change. So I've got to go another lane change. So I have kilograms in the top, let's move it to the bottom. So we're going to put kilograms in the bottom. Oh, but I see I have something about milligrams per kilogram, so let's put milligrams here. And in this case, they say that the medication order is 0.1 milligrams, so that's going to be 0.1 milligram per 1 kilogram. Am I done yet?
no.
No, because I have milligrams and I'm trying to get to milliliters. So that must mean I got to make another lane change. So since I have milligrams in the top, let's move it to the bottom. So now I have milligrams in the bottom. Ooh, wait a minute. But I see, oh, this is how I'm going to get from milligrams to milliliters because I have something about milligrams and milliliters. So now, since I have milliliters, because this says milligrams per milliliter, milligram and milliliter. So let's just plug in my numbers. This is 1 milligram per 1 ml. So 1 milligram per 1 ml. Now I'm in milliliters. I want to end up in milliliters. These two match. Now I'm done with my lane changes. So now let's cancel out myself. What can I cancel so far? Tell me what I can cancel.
You could cancel the pounds.
Pounds and pounds. What else? Where
You
else
can
do I have
cancel
a
the
match? Where I have one in the top and one in the bottom. What else?
Kilograms.
Let's cancel my kilograms. What else can I cancel?
The milligrams.
Let's cancel my milligrams. Can I cancel anything else? No.
No, that's it.
That's it, because I don't have another match. I don't have milliliters down here, so there's no more to cancel. And I don't want to cancel milliliters. I want to end up in milliliters, so I can't cancel it. So now I've already, I started, I flipped, I cancel, now I just solve. So now I just do the math. It's 44 times 0.1 divide by 2.2. And what do I end up with?
2 milliliters.
2 milliliters. That's what I want. So I'm going to draw up 2 milliliters. Okay. What kind of syringe am I going to use for 2 mLs?
A 3 ml.
All right. Let's use a 3 ml syringe. Okay. So let's use a 3 ml syringe. So we have 1 milliliter, 2 milliliter, 3 milliliter. We're going to draw this up to 2 milliliters. Okay. Just like that. Let's do another one, Brian. How are you feeling about this? Brian, how are you
I
feeling?
like this pattern.
Say it again.
Along with the pattern and just the tops and the bottoms and canceling it out. You made it
Yeah.
very easy.
If you'll do that, it's less to think about. So I want you to practice again with me. You ready? Okay. And do me a favor. I want you to just adjust your camera a little so I can see your whole face. There you go. And let's do this next one. All right. Just keep your device unmuted so that you can just talk the whole time. Let's go. We're going to do number 18, and then we got to pick up the pace. We got a lot more to get to. So let's go. Let's do number 18.
And then the 22 pounds is going to be on top.
All right. Keep going.
And then since medication order is 15 milligrams or kilograms, medication supplies 150 milligrams.
Okay, just give me a starting and an ending point so I know where I'm going on my trip. So I'm starting in pounds. I'm going to end up in where?
Milliliters.
I want to end up in milliliters. So I got to make some lane changes to get me from pounds to milliliters. All right, I have pounds right now. Let's get me out of pounds. What do I do?
Put the pounds in the bottom.
Okay, what goes in the top?
Kilograms on the top.
What's the number for kilogram?
2.
Kilogram. Remember the relation, because what you're asking is what's the relationship between pounds and kilograms? And the relationship is 1 kilogram is 2.2 pounds. Okay. Notice this pattern that we keep seeing. 1 kilogram is 2.2 pounds. 1 kilogram, 2.2 pounds. 1 kilogram, 2.2 pounds. Notice the pattern there. Okay. Now I'm in kilograms, so I got to get rid of kilograms because I need to end up in milliliters. So that means I have to get rid of kilograms. Since I have kilograms in the top, we're going to put kilograms in the bottom. So let's do kilograms. Now, this medication is so many milligrams per kilogram. Let's put a 15 there because we say 15 milligrams per 1 kilogram. So that's going to be a 1. But right now I'm in milligrams. Am I done?
Change.
Am I done?
Not done.
Not
We're
done.
doing
So
a
what do
lane
I
change.
need? What do I need to do?
Can you do another lane change?
Let's do another lane change. So what goes in the bottom? And Brian, if you can, just speed it up a little for me.
Do the milliliters.
Okay. Well, I don't have milliliters yet. Right now I have milligrams in the top. So notice here, I went from pounds to pounds, kilograms to kilograms. I'm going to go from milligrams to milligrams. So I'm going to put milligrams there. And do I have anything in here that talks about milligrams? Oh yeah, right here. I've got 150 milligrams per 5 mLs. So that must mean I'm going to go from milligrams to milliliters. And they say 150 milligrams in 5 mLs. I just take the numbers, 150 milligrams, 150 milligrams, 5 mLs, 5 mLs. Now I end up in milliliters. I want to end up in milliliters. Boom. Now let's cancel out what I can cancel. Let's go. Pounds, pounds, kilograms, kilograms, milligrams, milligrams. I'm left in milliliters. Do the math. Tell me what I multiply. Tell me what I divide, Brian.
2 by 15.
Okay.
And then
say it again.
15 times 5.
Okay, give me the whole thing.
Times 15.
What times
Times
15?
5. 22.
Okay, so 22 times 15 times 5. What else?
So I got 1,650. And then I'm going to divide that.
Okay, and you don't even have to put equal. So this is the way I want you to put it in your calculator. In fact, clear out your numbers for me. And I want you to just put the numbers exactly as I tell you. You ready? You ready?
I'm ready.
Okay. And I don't know, there seems to be a lag in your response, but so just put in 22 times 15 times 5. Divide by 2.2, divide by 150 equals. What do you get?
5 milliliters.
Your answer is 5 milliliters. Okay. All right. So, Brian, we're going to give you a little break. And Cody, you want to try it? Cody, can I bring you in?
Cody, you're on mute.
There we go.
Hey, Cody, how you doing?
Doing good, buddy.
Are you the same Cody I talked to yesterday?
Yep.
Hey, welcome, my man. How you doing? All right. Well, I see you
Doing
made
good.
it here. So welcome aboard. Welcome to your new family. How are you learning so far today? How's this been for you?
I really like this pattern.
Was that you
Never
do or
been
do
taught
not
this
like?
before.
What'd
I
you
do.
say? You do like. Okay, great. All right. You learning? Is this pretty easy this way?
Yeah, I really like this pattern.
You like this? All right. Well, let's spread this around, my man. All right, let's go. So we're gonna do. Let's go ahead and do this next calculation. So this is one where we're doing a maximum dose. So sometimes, like, okay, some drugs that come to mind are fentanyl may have a single dose max, or succinylcholine may have a single dose max. Many medications, midazolam, Versed, may have a single dose max or a cumulative max. So in this situation, they're saying, hey, regardless of what the patient weighs, if their calculated weight or the calculated dose puts you over the max, you still have to stay with the max. Okay. So even if their weight, even once you do the calculation, if it says you get a number way up here, but the floor, the max is here, or the ceiling, I guess, then we cannot go above the max. So we're going to try an example like this. In this case, we have an order for, well, let's start. In this case, I want to start with the weight so I don't forget it. So we have 176 pounds. So I got that part. But they want to know what is my dose. So I want to end up with a dose, and this dose needs to be in milligrams. Now, what is the maximum dose here? What's the maximum dose in this situation?
1,000.
The maximum dose is 1,000 milligrams. So as long as my calculated number is under 1,000, we're going to go with whatever we calculated. However, if my calculated value comes to a number greater than 1,000, then we have to stop at 1,000. Does that make sense? Because we don't want it to exceed what's safe for this medication. Okay? The effective dose, or safe effective dose. So in this case, I have pounds here. How am I going to get rid of pounds? Because I want to end up in milligrams. Right now I'm in pounds, so that must mean I have to do a lane change to get rid of pounds. How am I going to get rid of pounds?
Go to kilograms.
Okay, let's get me rid of pounds though. So what do I do with pounds to get rid of pounds?
Put pounds in the bottom.
There you go. Put pounds in the bottom. So what goes on top of pounds?
The kilograms.
Kilograms. Is there a relationship between kilograms and pounds? What number goes in front of kilograms?
1.
What number goes in front of pounds?
2.2.
Boom. Now I'm in kilograms. Can I stop? Yes or no?
No.
Nope, because I'm trying to get to milligrams. I need another lane change. And whenever I say a lane change, that always means I take this and move it to the bottom. So what do I do next?
Put kilograms in the bottom.
Let's put kilograms in the bottom. What number goes in, or what unit goes in the top? Not the number yet. What unit goes in the top?
The 15 milligrams.
But 15 is a number, but what unit goes in the top?
The milligrams.
Let's put milligrams there. Now, what number goes in front of milligrams?
The 15.
What number goes in front of kilograms? We can just put a 1 because
1.
there is no number, so it's understood to be 1. Now, in this case, I end up in milligrams. Do I need another lane change?
No.
No, because I end up in milligrams. I want to end up in milligrams. Those two match. So now let's just cancel what I can cancel. What do I cancel?
The pounds.
Pounds. What else?
Then the kilograms.
Kilograms. What else?
And then we're going to multiply and then
That's
divide.
it. No more canceling. Multiply what numbers?
176 times 15.
And divide by?
Divide by 2.2.
What do you get?
And that should be 1,200 milligrams.
1,200 milligrams. Do I give them 1,200 milligrams?
No, because that's above the max.
That's above the max. So what is my number that I'm going to give them in milligrams? So my calculated number says I should give them 1,200 milligrams, but the max dose is 1,000 milligrams. I can't go above the max, but I can give them the max. So what am I going to give them? How much am I going to give this patient? I'm going to give them the max.
So you just give them the maximum dose?
Yeah, because the calculated number says 1,200. It's just I cannot go above 1,000. So in that case, I'm going to give them 1,000.
Okay.
Does that make sense?
Yep.
Okay. And now, and I'm not picking on you, but what I want you to know is this is exactly why I'm doing this, because as a paramedic, you 100% need to know how to do this, right? This is why I always tell people that you don't want to be the 950 medic, the 950 nurse, the 950 doctor. You don't want to be the minimum of anything. Because yes, you may pass because you answered enough questions on the test, but in real life, patients need you to be 3,000 plus level where you know how to take care of them. Does that make sense? And that's why we're doing this. I'm not picking on you, but I want you to go back through this. I want you to make sure that you're understanding this because you're going to be that ALS provider in charge needing to know how to do this in real life, right? It does your patient no good that you have a patch on your shirt or a label on your shirt and a wallet card that says Big Bad Paramedic and everybody congratulates you. All of that is good, but it means nothing when somebody's life is on the line and they're sick and dying in front of you. You need to be that person that when you show up, they're like, whew, I'm so glad it's you. As opposed to when you show up, they're like, oh boy, right? I'll just walk. Okay. All right.
Completely agree.
Good. And I'm glad you're here and you've taken action to improve. So I want to kudos to you. Let's do another one, my man. So let's do number 20. We got a lot more to do. If you guys are good, I'll keep going. We'll go to at least the top of the hour, and then we'll try to cut it off. All right, let's do this next one, my man. All right, I'm talking to Cody, right? Yeah. Cody, what we got?
You're gonna put pounds on the top.
All right.
The 220.
Okay, so we've got 220 pounds. I like that. What else?
Put pounds on the bottom.
Okay. Ooh, I like it. All right. What am I trying to end up in?
You want to end up in milligrams?
Yep. I want to end up in milligrams. I got to make some lane changes to get me there. What goes in the top here? What unit?
Kilograms.
Kilogram. Give me some numbers. What goes in front of kilogram?
1.
What goes in front of pounds?
2.2.
2.2. What am I going to do next?
You're gonna put kilograms in the bottom.
Check you out. Kilograms in the bottom. What goes on top of kilograms? All right, you on a roll, man. Don't let me down. Don't embarrass us in front of the world. Say it
Putting
again.
pressure on me.
No pressure.
Um,
What
put
goes up? What
milligrams
unit
on
goes
top.
above? You may be saying it. I just can't hear. Say it again.
Milligrams.
Ooh, okay. All right. Now I need some numbers. Find something in this thing that talks about milligrams over kilograms. Where are my numbers?
Put 1 milligram
1 milligram over.
and 1 kilogram.
Okay. Now I'm in milligrams. I want to end up in milligrams. Ooh, that sounds like I might be done with my lane changes. However, they give me some other information. My max dose in this situation is what?
80.
80 what?
80 milligrams.
Okay. So I can go up to 80, but I can't go above 80. So let's cancel out what I can cancel. What can I cancel?
Cancel out pounds.
Let's get rid of pounds. What else can I get rid of?
Kilograms.
Kilograms. What else can I get rid of?
Nothing else.
So now I'm left in milligrams. I want to be in milligrams. Let's do the math. In this case, it's simply
220 divided by 2.2.
And what do I come up with?
100.
Okay.
So you're just going to give 80 milligrams.
Okay. In that case, I come up with 100 milligrams, but I can't give that because that's going to exceed the max dose. So I'm going to give this patient what?
80 milligrams.
80 milligrams. That's going to be my final answer. How you feel about that one?
Good.
Okay. I'm going to leave that next one. Oh, actually, let's do this next one. Okay, because this will introduce a little more for us. Let's do this one. You're on a roll, my man. Now, take a deep breath, Cody. All right, Cody, you got this. Okay.
All right.
I'm here to affirm you, King. Put on your crown. You got this, my man. All right, let's go. So in this one, we have a child that weighs 30 kilograms. Now, in this case, we're already starting in kilograms. Now, all these other examples, we started in pounds and we had to go, we started in pounds and we had to get to kilograms. When we already start in kilograms, we're just going to eliminate that step. Okay, so let's go back to here. In this case, we have 30 kilogram patient. So that already took care of a lane change for us. Mm-hmm. So we have a 30 kilo patient, but I need to end up what's my destination?
Milligrams.
Is that my destination?
mLs.
Aha. Okay, and that's why it's so important that I know my starting and my ending point. My ending point here is milliliters because they say how many milliliters should be administered. Or in real life, you don't have a question saying how many mLs, but that's what you need to say. How many mLs do I need to draw up to administer in this patient's body? Okay, so I have kilograms, but I'm trying to get to milliliters. That means I must make a lane change because these two units don't match. So how am I going to get rid of kilograms?
Put kilograms in the bottom.
Let's put kilograms in the bottom. Now, what goes on top of kilograms in this case?
Milligrams.
Okay, we're going to put milligrams because that's right here. I have 20 milligram per kilogram, so I'm going to put milligrams. My number is going to be 20. That's 20 milligrams per 1 kilogram. Am I done?
No.
Why?
You got to put milligrams in the bottom.
Okay, and I'm not done yet because I have milligrams and milliliters, and those two don't match. Yep. Okay, so that must mean I've got to move milligrams to the bottom. So let's do it. That's going to put our milligrams in the bottom. What goes on the top there?
Milliliters.
We're going to put milliliter. And what's my number for milliliter?
You put the 5 mLs.
Okay, my number for milliliter is 5. What's my number for milligrams?
100.
I'm going to put a 100 there. Okay, now I'm in milliliters. I want to end up in milliliters. Okay, boom, I have a match. But
so you can cross
they
out.
also tell me that, so let me make sure I used everything. I used the 30 kilograms. I used the 20 milligram per kilogram. I used the 100 milligrams per 5 mLs. Okay, I've used all my information with the exception of, they say a max dose of what?
500 milligrams.
Okay, we have a max dose of 500 milligrams. Okay, now that's not milliliters. So in this case, what I'm going to do is I first have to just do this part to end up in milligrams. In this case, if I do 30 times 20, how many milligrams is that? If I just do this part, 30 times 20
600.
is?
600.
Okay, but is that above the max?
Yeah.
So what is the max that I'm going to give?
500.
So the max I
milligrams.
can give is 500 milligrams. So now, here's what I'm going to do here. I'm going to take 500 milligrams, but I need to ultimately end up in milliliters. How do I get rid of it? How do I get rid of milligrams?
Put it in the bottom.
Milligrams in the bottom. I'm going to take the same information that I had here. That's going to be my, I had milliliters, so that's going to be 5 and then 100. And now simply do 500 times 5 divided by 100. Now, you didn't have to write it separately like that. I'm just doing it so that you see how we're doing this next step. I mean, we could have just continued, but I'm just doing it separately. So do 500 times 5 divided by 100. And what do you get?
25 milliliters.
25 mLs. That sounds right. Yep. We're going to draw up 25 mLs. Now, what kind of syringe am I going to use to draw up 25 mLs of something?
You could use a 30 ml syringe.
You have a 30 ml syringe?
Yep.
Do you? Okay. If you have a 30 ml syringe, or if you have a 20, or if you have a 10, you have to use whatever you have to use. Okay. In
Or a
this
50.
case, I mean, heck, you could draw this up in a 50 ml syringe and do half of it. Okay. Okay, cool. Now let's do another one. How are you feeling about this, Cody?
This is awesome. This is good.
You like this? Okay. All right, man.
Yeah.
You're getting a little too excited. This is mad math, man. Calm down. All right, let's do another one. So let's do number 22. What are we doing here? This one is okay. This is a medication reconstitution. So this situation is where you've got some kind of liquid and a powder. So you have the diluent. Remember, it's diluent and not dilutant. So it's the diluent and the powder. We got to mix those two together. And then we don't shake it aggressively. We just kind of gently invert it to mix the two. So the powder and the liquid mix. And what we're saying is once you mix those two ingredients together, the new formula is going to have a certain concentration. So in this case, they say that after reconstitution, the concentration is, so in this case, they give us this information about a vial contains 1 gram of powder. In that case, we don't actually need this information in the calculation because we're not worried about powder. We only care once the powder has been mixed with the liquid. So once it's been mixed, then our concentration is going to be 200 milligrams per ml. So this is on number 22. Now, let's start with our order, though. They say we want to do 600 milligrams. And they ask how many mLs should be administered. So we want to end up in milliliters. Now, since I'm starting in milligrams, but I want to end up in milliliters, those two don't match, so I've got to do a lane change. How do I get rid of milligrams here?
Put it in the bottom.
Let's put it in the bottom. What goes in the top then?
200 milligrams.
Okay, so we're going to go with milligram. Oh, no, wait. I can't do milligrams in the top because I put milligrams in the bottom.
Oh.
So what goes in the top?
mLs.
Aha. Because now I have mLs, and remember, I want to end up in mLs. Now I have a match. Okay, so what is my number that goes in front of ml? What's my number
200?
that's here in front of ml?
200.
No, 200 is in front of milligram. But what's my number?
1.
Aha, that's a 1. So my number, if there is no number, it's understood to be 1. So my number in front of mLs is 1. What's my number in front of milligrams?
1.
In front of milligrams?
200.
200. Okay. Now, let's cancel out what I can cancel. Milligrams and milligrams cancel. I'm only left with numbers and milliliter, which is what I want. So now it's just 600 divided by 200, and I get
3 mLs.
3 mLs. Okay, I'm going to take a 3 ml syringe, draw up 3 mLs. Okay. You want to do another one?
Sure.
I like it. Let's go. Now you tell me what to do.
All right.
Start me with the order.
We're gonna put.
What's my order? Because notice the pattern here. I typically either I start it with the weight, or I start it with the order. Okay. In this case, start me with the order.
1.5 grams.
Let's go 1.5 grams. What am I trying to end up in?
mLs.
I want to end up in mLs. How many mLs? Okay. Right now, those units don't match. That means I've got to do a lane change. What goes where?
Put the grams in the bottom.
Put the grams in the bottom. What goes on top of grams? Because ultimately, I got to end up in milliliters. But right now, I'm in grams.
Yep.
So what?
Put the 500 milligrams on top.
Yeah, but remember 500. So
or the
500 milligrams is partnered with milliliters.
Mm-hmm.
So right now I can't put milliliters there because there's something else taking that spot. But what I can do is I can just put milligrams here. So watch what I do. And this, just watch me for a moment. Just watch the screen. In this case, I have grams and grams. But I got to ultimately get in milliliters. But what I do know there's a relationship between grams and milligrams. So watch this. 1 gram is 1,000 milligrams. Now I have milligrams in the top. Let's put milligrams in the bottom and milliliters in the top, because I have something in my problem with milligrams and milliliters. Milligrams, milliliters. Now I just put the numbers in. What goes in front of milliliters? 1. What goes in front of milligrams? 500.
500.
Now, I end up in milliliters. I want to end up in milliliters. I have a match. Let's cancel what I can cancel. Grams, grams, milligrams, milligrams. Now just do my numbers. Do 1.5 times 1,000 divided by 500. And what do I end up with? That's a lot of numbers.
3 mLs.
I end up in 3 mLs. Okay. Now, what you noticed here is when I got to grams, remember, I can't end up in grams because my medicine is in like milligrams per milliliter. So I got to some kind of way get to milligrams. And the way I did that is I just do the conversion from grams to milligrams. That puts me in milligrams. And then I get rid of the milligrams by moving it to the bottom, and I put milliliters in the top. Does that make sense, Cody?
Yep.
All right, teach that back to me.
So essentially, there are 1,000 milligrams in 1 gram. Vice versa, 1 gram equals 1,000 milligrams, which is the conversion.
And keep going. Walk me through this whole thing again.
So 1.5 grams is the order. So you're going to put that as the first number. Then you have to get to mLs. So we have to put the grams down in the bottom. then you are going to take, we got to convert to milligrams. So you put that in the top. 1 gram is the bottom number because you put 1 just like 1 ml if there's not a number. Then you are going to put 1,000 for the milligrams, which equals the 1 gram. And then we still got to get the ml. So you're going to put milligrams in the bottom. And then you're going to put ml at the top for the concentration. You're going to put 1, and then concentration is 500 milligrams. You put that in the bottom. And then now that you're at mLs, then we can cross everything out and then multiply and then divide, and that'll give you your answer.
There you go.
Milliliters.
Okay, and that's how we got that one. Okay, let's do another one. Now, I'm going to just we'll go to me for a moment. We'll just go to me, just in the interest of time, because I want to get through some more. And then you can watch the replay back. So everybody on YouTube, hope you're enjoying us. Are you learning something? Those of you on YouTube and Facebook, are you learning something today? And then those of you on Zoom, give me a thumbs up if you're learning something today. Give me a thumbs up. Okay, good. All right, let's keep going. So we're on question number 24. In this case, they give me, all right, let's find my order. The order is for 2,000 units. Whoa, units. Okay, so maybe this is something like insulin or heparin or something like that where it's in units. In this case, I have an order for 2,000 units. And that's what it's called, 2,000 units. But they want to know how many mLs. So I'm going to end up in mLs. But now, in order for me to get rid of units, I've got to move it to the bottom. So let's take units there, move it to the bottom, and put units. Now, do they give me anything about units in here? Well, they give me, so they say a vial contains 5,000 units. But they say after reconstitution, the final volume is 5 milliliters. What that's saying is we're going to have 5,000 units in 5 milliliters. So I'm going to put milliliters in the top. And now just plug in my numbers. 5,000 units, 5 milliliters. I'm left in milliliters. I want to be I want to end up in milliliters. I have a match. Let's cancel out what I can cancel. Units and units. Now I simply multiply 2,000 times 5 divided by 5,000. And what do I get? 2. I'm left with 2 mLs. Okay? And if like I said, just in the interest of time, I'm going to speed it up a little because I want to get through some more examples. Now, we're going to change gears to now we have an IV pump. So we're going to give fluids via a pump. If you have a pump, it's always a great idea to use a pump because it's going to give you the most accurate calculations. And when it comes to giving medications, you want to be as accurate as possible. So if you have a pump, always use a pump. However, you may not always use a pump, but let's say you do for this example. In this case, they want the final pump rate to be in mLs per hour. So my final answer needs to be mLs per hour. Now, let's see. Okay, my order is to give 1,000 milliliters. Wait a minute. So I'm already in mLs, and I want to be in mLs. So right now I'm already in milliliters. And they say give this over 10 hours. So all I have to do is put over 10 hours. Now I end up in milliliters per hour, which I want to do. I don't have to do any lane changes because I'm already in the units that I want to end up in. So I simply just do the math. There's nothing to cancel out because I'm in the final units already, and we never cancel out the final unit. So I simply do 1,000 divided by 10, and what do I get? So we're going to set these fluids to 100 ml per hour. Okay, 100 ml per hour. Does that make sense, everybody? Yes or no? Yes. Okay, let's do another one. Let's okay, in this one, we're on question number 26. They want us to do, okay, the final answer, they want it to be in milliliters per hour. Milliliter per hour. They say administer 300 milliliters. Whoa, I'm already in milliliters in the top, milliliters in the top. Sound good so far. But they want it over 90 minutes. Now, I have minutes, but I need to be in hours. So that must mean I need to do a lane change. So in this case, I got to somehow get hours to the bottom because here it's in the bottom. What I can do is I can put hours in the bottom and minutes in the top. So now this is a different pattern, but it's the same thing. We still have the unit in the top, the unit in the bottom, and that's how we're going to cancel it out. Is there a relationship between minutes and hours? Yeah, we know that. 1 hour is 60 minutes. So in this case, my final answer is going to be in milliliters per hour. I have a milliliter in the top, milliliter in the top. I have hour in the bottom, hour in the bottom. Now I just cancel out anything I can. So I'm going to cancel out minutes and minutes. And I simply do the math. Do 300 times 60 divided by 90. And what do I get? $200, yeah. So now I'm going to pump these fluids at 200 mLs per hour. On the pump, I literally just adjust my setting to 200 milliliter per hour. I start the pump and then it starts flowing. Of course, we've got to make sure that we're using pump tubing and all of that. But this is just the calculation part. All right, I'm going to skip this next one for you. I want you to try you try number 27 on your own. I want you to set it up and then tell me what your final answer ends up being. So they want our final answer in milliliters per hour. We're going to do 75 mLs, but in 30 minutes. But I can't be in minutes. I have to end up in hours, so I need to convert from minutes to hours, just like we did before. In fact, let's put that other example so that you can see it and just follow the same pattern. Somebody let me know when you get your final answer on number 27. What's your final answer on 27?
I got 150 mLs.
Yep, we have 150 mLs. Did everybody else get that?
Yes.
All right, 150 mLs per hour. Okay, now, in this case, this is a question about how long it's going to take. So this question is how long that's going to take, and they want it in hours. Our final answer needs to end up in hours. We have a 1,000 ml bag. Okay, now, right now I'm in milliliters, but I need to end up in hours, so I need to do a lane change. Let's go from milliliters, let's move it down. So we're going to do milliliters. They say I have, milliliters in hours. So milliliters in hours. There's a 1 in front of hour, 200 in front of milliliter. In this case, what do? I cancel out my milliliter. I'm left with hour, which is what I want to be in. That's just 1,000 divided by 200. How many hours is this going to take to infuse this? That's going to be 5 hours. Boom. Just like that, I'm done. And notice that we've done lots of different types of questions so far, but we've used the exact same roadmap with every single question, right? Does that make sense? That's pretty cool. We have one system to follow with no matter what kind of question they give us. Okay, I'm going to skip 29 and 30. You can do those. I've already provided the worksheet for you, but let's go to the next one. Oh, this is it. Oh, yeah, I even started this one. I definitely want to cover this one. 31. Monica, you want to come back in? Those of you on YouTube, Daddy Teddy, you were with us last week. So let's do, Monica, let's do number 31. Let's put you back in. And you ready?
Okay. Sure.
I like it. Like that
No.
enthusiasm. Let's go. We want
Yes,
to
but
end up.
no, because this is a whole different one.
Hey, but it's no problem. We got a roadmap to follow. Watch this. We're just going to follow the roadmap.
Okay.
We want to end up.
Sure.
They ask us, what is the rate in drops per second? Okay. So our final answer needs to be in drops per second. Okay.
Okay.
All we're going to do is follow our steps. We have 1,000 mLs. And they want us to infuse that 1,000 mLs over 8 hours.
Okay.
Wait, what number am I?
So we have to
130.
convert some stuff.
Okay, so 1,000 mLs over 8 hours. So we could just write it like that because that's 1,000
Yep.
mLs literally over 8 hours. Okay,
Sure.
now they say we're going to use a 15 drop set. So right now I'm in mLs, but I need to be in drops. So I got to get rid of this mLs. All I do is move it to the bottom. Is there anything up here where mLs is in the bottom? Oh yeah, right there. So I have drops and
Yep.
mLs. So let's put drops and mLs. Put the numbers in. 15 drops, 1 mL. Okay.
Okay.
Now, what unit am I in? In the top.
Now you're in drops.
Is that what I want to be in?
Yes.
Okay. What unit am I in the bottom?
ML.
What do I want to be in?
Seconds.
Okay. Am I done?
No.
No. So now, is there a way for me to, I got to do something with this ml. But
So we're going to have to, well, that'll cancel out with the other ML.
okay, well, let's see. Let's see what you're talking about. All right. But I also have an hours here in the bottom, and I got to get rid of hours some kind of way. So since it's in the bottom, where
Yes.
else do I need to put it to get it to cancel
On the
out?
top.
Aha. So let's put hours in the top. Now, there is a relationship between hours and seconds, but I don't want you to make that jump. Is there a relationship
That's
between
huge.
hours and minutes?
Yes.
Ooh, so I could go
60.
minutes here. And what's the relationship?
1 hour, 60 minutes.
1 hour is 60 minutes. Okay, so now I'm in minutes, but I need to be in seconds. How could I end up with seconds on the bottom?
We're going to have to put minutes on the top.
Well, let's put minutes on the top. And then, I could put seconds on the bottom. Is there a relationship between
Yes.
minutes and seconds?
Yes.
What is it?
There's 60 or 1 minute has 60 seconds.
Check you out. So look, just like that, I end up with drops in the top, seconds in the bottom, which is what I want. I want drops in the top, seconds in the bottom. Let's see if I can cancel out some stuff. And make sure
Yes.
I've used all my
We can
information
cancel
I
out the
have.
MLs.
I can cancel out mLs. What else can I cancel?
Hours.
Let's cancel hours. Anything else I can cancel?
Minutes.
Minutes. I'm left with
And that
drops
leaves
per
us with
second, which is what
drops.
I want. Just do the math. Tell me what my math
Yes.
is.
1,000 times 13
Let's do
divided by
1,000
8.
times 15, divide by 8.
Oh, 15. Sorry, I said 13.
Okay, so
15
1,000 times
divided by-
15, divide by 8.
Divided by 8, divided by 60. And divided by 60.
Okay, give me an answer.
0.52.
Ooh, no, wait. Now that's 0.52 what? Okay, so that's 0.52 drops per second.
Per second.
Now, if I'm trying to look at a drip chamber, how do I get 0.52 drops? Like, do they ever come out like 0.52 of a drop or 0.39 or 0.872? No, they come out in drops of 1. So I always need
Right.
to get my drops to 1 because I can see 1 drop, but I can't see 0.52 of a drop, right?
Right.
So all I'm going to do, because I always want my drops to be 1 if possible.
Sure.
So all I do here is I take 1 divided by 0.52, and that's going to give me my seconds. So if I do 1 divided by 0.52, what do I get?
1.92.
1.92. Now, 1.92 seconds sounds kind of close to what seconds?
2. So 1 drop every 2 seconds.
So that's going to be 1 drop every 2 seconds. Okay. So what would I do here? So here's my time. So every 2 seconds. So 1, 1,000, 2, 1,000, 1, 1,000, 2, 1,000, 1, 1,000, 2, 1,000. So what I'm saying is every other second, I want to see a drop fall. Okay. And if
Sure.
my drops are falling, 1, 1,000, 2, 1,000, 1, 1,000, 2, 1,000, 1, 1,000, 2, 1,000, 1, 1,000, 2, 1,000. If my drops are falling at that rate, that's roughly 1 drop every 2 seconds. And that's where I'm going to hold it. Okay. Now, when you hear people say, like, give this
Sure.
medication and titrate to effect, what that means is we're going to change the dosage to get us to the desired outcome. Let's say it's their heart rate that we're trying to speed up, or it's their blood pressure that we're trying to increase. We're going to incrementally change it to hopefully get us a better effect. Okay. But in this case, our
Sure.
answer here is going to be, our final answer is going to be 1 drop every 2 seconds. Now, that's the seconds part. But what if they also asked, what is the drop in minutes? In that case, I just ignore, like in minutes, I just ignore this last part because that'll get me in minutes. So I just skip this part and do the other calculation. So it would have been 1,000 times 15 divided by 8 divided by 60. And that would have been 31.25 drops per minute. We're just going to round that to 31 because
Sure.
I can't measure a 0.25 of a drop, but I could count 31 drops. So that would be 31 drops in a minute. The reason I want you to know how to do it in seconds
Perfect.
is because do you want to sit there and count 31 drops for a minute? Or is it easier to count 1 drop every 2
No.
seconds? Right. So I like to get these numbers down to
Yes.
drops per second because that's what we're going to actually do in real life. And that's a lot more practical. Does that make sense, everybody, what I just said? All right. So Monica, how did you feel about that problem? Okay. Initially, it seemed a little intimidating.
It was intimidating.
Keep going.
Yes. And then it was
Hold on. I
fine
got to
once
hear
I
this.
followed.
Wait a minute. Say it again.
I said it was intimidating at the beginning when I just looked at it, but as I followed the roadmap, it was actually just as simple as any of the other ones.
Man, check you out. So since you like this so much, let's do another one. Let's go.
Awesome. All right. So we want to get the rates in drips per minute. So we'll put GTT on the top and minute on the bottom on the right-hand side.
Okay.
Perfect. And then on the left-hand side, we're going to do 500 ml. And then on the bottom over 3 hours. So we'll put 3 hours on the bottom. And then we need to
Just follow the
get
steps.
on the bottom.
Say it again.
Okay. Oh, I was going to put ML down on the bottom
Oh, yeah. That sounds good.
and then the 20 and then 20 GTT on the top
Okay. Then
and then
what?
the 1 ml on the bottom. And then we need to
Say it
convert
again.
hours to, we need to convert. So we're going to put hours up and then minutes on the bottom.
Okay.
It'll be 1 hour.
And you're starting to freeze there, but okay. So 1 hour is 60 minutes. Now, let's cancel out what we can cancel.
Yes.
Okay. I do end up with drops per minute, which is what I want to end up with, is drops per minute. I'm going to cancel what I can cancel. Let's get rid of milliliters. Let's get rid of hours. I'm only left with drops per minute, which is what I want. Just do the math. 500 times 20, divide by 3, divide by 60. And what do I end up with?
$500 times 20, divide by 3, divide by 60 is 55.55.
Okay, now in this case, I'm just going to round this. So 55.5, we're just going to go up a number. Let's go ahead and round this to approximately 56 drops per minute. Okay.
Yes.
Now, in that case, we wanted it to be in drops per minute, but ideally we want to get it into drops per second. Okay. Now, here, let's skip the next one. You can practice this one on your own. Let's go to, okay, let's go to number 34. Monica, we'll take 2 more from you, and then let's swap out. Let's do 34.
Okay. Okay, so what's the rate in drops per minute? So we're going to put GTT on the top, minute on the bottom on the right. And then we're going to do 60 GTT on the top and 1 ml on the bottom.
I'm already in drops.
Yep.
But what
and
else?
Then we need to have ml on the bottom. So we're going to put 120 ml on the bottom. Oh, just kidding. I lied. We want ml on the top.
Ah, okay.
120 ml on the top.
Okay.
And it's over 60 minutes. So we're going to do 60 on the bottom. And so
now I'm ending up in minutes. I want to
ML.
end up in minutes. I just cancel what I can cancel.
Yep.
Now notice here, I have a 60 and a 60. I can also cancel those. I'm only left with what?
120.
That's my answer. Check you out. All right, one more for you.
All right. So this one here, the rate we want to get is GTT over minutes on the side. On the left, we'll do 60 GTT over 1 ml. And then we're going to do 250 ml on the top. And then on the bottom, we're going to do 2.5 hours. And then we have to convert that. So we're going to do 1 hour on the top. And then 60 minutes on the bottom. We'll cancel what we need to or can, and then multiply.
So what can I
divide.
cancel?
So you're going to cancel out the mLs. You're going to cancel out the hours. We want to be drops per minute, and we're left with drops per minute based on that canceling.
Notice what else I can get rid of. I have a 60 and a 60.
Oh, perfect.
So
then we're just going to take 250 divided by 2.5.
All right, what you get?
100
Boom.
drops per minute.
I mean, all right, now you're showing out. You like that?
Well, I'll give someone else a chance. That's great. Thank you.
You like that?
It's great. I love it.
Okay, pretty cool. All right. So, Cody, you want to come back in? All right, for those of you in YouTube, how are you feeling? How are you feeling about everything so far? I do want to be cognizant of the time. We're hitting the 2-hour mark. I'm going to, can we do a few more?
Sure.
I at least want to do 1 per category, and then I'll leave you a couple more to do. And for those of you in the community, I literally came up with like 170 more drug calculation questions for you with the answers, and I'll be happy to provide that. All right, so let's do another one. Let's bring in Cody. Cody is just having too much fun on his first day with us. Let's bring Cody in. Brian, I don't know what happened to Brian. He's like, I want no part of this. Brian, you still with us? Evelyn, you still with us? All right, let's keep going. So Cody, they want this in drops per second. Okay, so they want this in drops per second. which is kind of what I want to put. If I'm going to do it by gravity, I want to try to get it in drops per second because that's easy for me to see. So how am I going to set it up?
I'm gonna put 60 drops on the top.
Mm-hmm.
Then you're gonna put 1 minute on the bottom.
Okay. Now I'm already in drops on the top, drops on the top. That matches.
Yep.
But I'm in minutes in the bottom. So what do I got to do?
So you got to go to seconds. So put 60 seconds on the top.
Oh.
Or no. Put minutes on top.
Aha, because that's the only way I'm going to cancel out minutes.
Yep.
I have to have one in the top and one in the bottom. So if I put minutes in the top, then seconds in the bottom, what's the relationship?
So 1 minute, 60 seconds.
1 minute is 60 seconds. Watch this. I'm going to cancel out minute. I'm left in seconds, which is what I want. I can cancel 60 and 60. All of that is left with 1.
So 1 drop over 1 second?
Yeah. So that means 1 drop every second. Okay. So that means if here's my timeline, and here's every second gets a drop. Drop. That would be 60 drops in a minute or 1 drop a second. Okay. All right.
Yep.
Let's do 39. Actually, yeah, we'll do 39.
Put 20 drops on top.
Okay. So first of all, where am I going on this one? What's my destination?
How many seconds should pass between drops?
So that's like saying how many drops per second.
Yep.
Okay. So let's set it up.
20 drops on top
Mm-hmm.
per 1 minute.
Okay.
And
I want
then
drops. I'm
minutes on
ended up
top.
in drops. Keep going.
Yep. Put minutes on top.
Okay.
And then 1 minute per 60 seconds.
Okay.
And then cross out minutes.
Nice. Keep going. I like it.
And then
Noticing this
20
confidence.
drops.
Keep going.
20 drops per 60 seconds or every minute.
So what am I left with?
20 drops over 60 seconds.
Okay. But I don't need 20 drops. I need to get that to 1 drop. So I just divide 20 by 60.
Oh. .3.
So, but I don't need 0.33 drops. I need 1 drop. So what am I going to do? Remember, to get it to 1, all I do is do 1 divided by whatever my answer was. So if I get 1 divided by 0.333333 repeater, that's 1 drop every how many seconds?
3.
That's 1 drop every 3 seconds. So here's what it looks like. Here's my timeline. 1, 2, 3, 1, 2, 3, 1, 2, 3. Let's put a drop every 3 seconds. 1, 2, 3, 1, 2, 3, 1, 2, 3. Okay. So I'm going to sit there, and every 3 seconds, I want 1 drop to fall. 1 drop to fall. 1 drop to fall. Okay. You feeling better about doing these drips and all of that?
Yeah.
All right,
Yep.
let's do another drip. All right. Now, this is we can't play around. This patient's crashing. They're going into shock. Blood pressure's down. Heart rate's down. We got to start a lever-fed drip. Now, we need some norepi. All right, let's go. We're on question number 40.
Concentration.
So they want the concentration in microgram per milliliter. Microgram per milliliter. They give it to me in 8 milligrams mixed in 250 milliliters. I'm in milligrams, but I need to get to micrograms. I already have milliliters on the bottom, milliliter, milliliter. I already have a match there, but I got to do something to get me to micrograms on the top. Let's just move this milligram down, milligram, and put microgram. Is there a relationship between milligrams and micrograms that you've heard of? How are these
Isn't
two
100?
matched? Huh?
100?
Maybe not 100. Okay. So typically when we're going from if we're going from grams to milligrams to micrograms, all of those are factors of 1,000. So the relationship is 1,000 micrograms is 1 milligram. Okay. Cancel out what I can cancel and then solve for the rest. I cancel milligrams. I'm left with micrograms per milliliter, which is what I want. Just do the math. What you end up with?
32.
Nice. Look at you, my man. You, Monica, you guys are showing out too much. All right. Let's skip. Actually, let's do 42. How am I going to set it up? What is my final answer going to be in? Cody, my final answer is going to be in what?
Milligrams over milliliters.
Okay, let's set it up.
Put 1 gram on top.
Okay.
250 milliliters on bottom.
Okay.
We got to get to milligrams, so put the gram on the bottom.
Okay.
And then it's going to be 1,000 milligrams.
Mm-hmm. And how many grams?
And then 1 gram.
Okay.
1. And then we're going to crop. Well, we got to get to milliliters, right?
Yeah, but I already had milliliters in the bottom, which is what I want. I just got milligrams in the top, which is what I want. So now I just cancel out what I can cancel and solve for the rest.
Okay.
What can I cancel out here?
Cancel out the 1 in gram.
What's my answer?
4 milligrams per milliliter.
Say it again.
4 milligrams.
Okay. All right. Next. Let's see. Where are we? Let's go to. Yeah, this will be a good one. Let's do 43. You want to try it?
Sure.
Let's go. All right. What's my final answer going to be in?
Milliliters over an hour.
Okay. Set it up for me. Start with the order.
You're going to put micrograms on top over 1 minute.
So 6 micrograms over 1 minute. Okay. And then what else?
We are going to put the micrograms on bottom.
There you go.
And
well, just look at the information they give me. So I got something with micrograms. And what else? But what else can I? Okay, I got to do something with this information.
We can put the 4 milligrams on top.
Aha. So we could put, well, now in this case, I can't, because remember, I got to keep these two things matched up. In this case, this is 4 milligrams and 250 mLs. but I already have something in the bottom there, so I can't break up this relationship. But what could I go from? I could go from micrograms to, I could still go to milligrams.
So it'd be 1,000 milligrams.
Say it again.
1,000.
Okay, where does the 1,000 go?
1,000 milligrams.
Is
or 1,000
1 microgram?
micrograms.
Or which way does it go?
1,000 micrograms.
Yeah, so in this case, 1,000 micrograms is the same as 1 milligram. Now I have milligrams in the top. Let's get rid of milligrams. Is there anything in here that gets me milligrams and something else?
The 4 milligrams in the 250 mLs.
Aha. Now I can put my 4 in my 250, and that gets me milliliters in the top, milliliters in the top. But right now I'm in minutes, but I got to get to hours. So what could I do? Right now, minutes is in the bottom, so minutes is now going to go where?
Minutes on the top.
Minutes in the top, and then what am I going to put in the bottom?
Seconds.
Well, but I'm not trying to get in seconds. I'm trying to get in hours. Is there a relationship between minutes and hours?
You can put an hour.
Yeah. So now I have hours in the bottom, hours in the bottom. What's the relationship there? What's the relationship between minutes and hours?
60 minutes per 1 hour.
Okay. Now let's cancel what I can cancel. Let's get rid of microgram, microgram, milligram, milligram, minute, minute. Do the math. Tell me what my math is going to be. Say it out loud as you're doing it.
6 times 250 times 60 divided by 1,000 divided by 4
equals
22.5 milliliters per hour.
Boom. Just like that. Man, look at you. All right. So we're going to set this on our pump. This is going to be our lever-fed drip. We're actually going to do this at 22.5 milliliters per hour if we have a pump. Now, if we didn't have a pump and we had to do it by gravity using a 60 drop set, we could do that as well. But here, let's go to question number 44. Now, they want the rate in milliliters per hour. Okay, but I ultimately want you to get it to drops per second. So we're going to do both of these. You ready?
Yep.
All right, so let's just kind of go together. They want it to be in milliliters per hour, but I need to figure out because my pump just quit working, and now I got to do it by gravity. So we're going to start an epi drip. Well, let's start with the order. Okay, sometimes I find it's easier to just start with the order or start with the weight. In this case, let's start with the order. The order is 8 micrograms per minute. All right, right now I'm in micrograms per minute. I need milliliters per hour. All right, so what could I do? How could I get rid of micrograms? What's the way we get rid of anything?
Put micrograms on the bottom.
There you go. So now I have micrograms on the bottom, micrograms in the top. What other relationship could I have? Well, this is in milligrams. So what if I put milligrams there? Okay. And what's the relationship between milligrams and micrograms?
1,000 micrograms per milligram.
Okay. Now I have milligrams in the top. What can I do to get rid of it?
Put milligrams in the bottom.
Milligrams in the bottom. So what goes in the top? Give me something in here that has milligrams and something.
4 milligrams.
4 milligrams
and
paired with what?
250 mLs on top.
250 mLs. Okay, keep going. Now okay, but I'm in milliliters. Okay, I did want to get in milliliters, but I need to get in hours. Right now I'm in minutes, so give me another relationship.
So you can put minutes on top.
Minutes on top, because right now it's in the bottom. To cancel out, I have to put it in the top. And what would go in the bottom?
60 minutes for 1 hour.
60 minutes in 1 hour. Okay, now let's stop right there, because now I'm in milliliters per hour, which is what I want to be in. So let's just do that part of the calculation first. Let's cancel out what I can cancel. Microgram, microgram, milligram, milligram, minutes, minutes. I'm left with milliliters per hour. Give me that number.
So 8 times 250 times 60 divided by 1,000. 120.
Divided by 4.
Divided by 4. 30 mLs per hour.
Okay, so that first answer is 30 mLs per hour. Okay. Now, but what if I need so many drops per second? How can I get me to drops per second? And let's say I want to use a 60 drop set. So for simplicity, what I'm going to do is I'm just going to get rid of all this stuff since we've already figured that out. And let's go with 30 mLs per hour. But I need to get to drops per second. How am I going to do that? Let's say I want a 60 drop set, which is what I want to use. Where am I going to factor that in?
Say it again.
Right now, I'm in 30 mLs per hour, but I need to get to drops per second. So how am I going to set this up?
So we need to convert the hours to second.
Okay. But what have we been doing? We've been getting rid of this.
Put mLs in the bottom.
Yeah, let's do that. So now I have ml. Oh, wait a minute, but I need to be in drops. Oh, wait. If I use a drip set, a drip set is in drops per milliliter. And if I'm using a 60 drop set, that means it's 60 drops in 1 milliliter. Ooh, okay. Now, is there a way I can go from hours to seconds? I could, but let's make another jump first. What would I do?
So we got to go hours to minutes.
Okay, so what goes where?
So you're going to put hours on top.
Okay, what goes in
minutes
the
on
bottom? Huh?
Minutes on bottom.
Okay, what's the relationship?
60 minutes per hour.
Okay, now am I done?
No, then we have to put minutes on top.
And what on the bottom?
Seconds.
Okay. What's
1
the
minute
relationship?
per 60 seconds.
Aha. Now, watch this. I can cancel out milliliters, milliliters. Hours, hours. Minutes, minutes. But I can also, so I'm left with drops per second, but I can also cancel out a 60 and a 60. And now I'm only left with 30 divided by 60, which is
0.5.
But do I want 0.5 of a drop? I always want my drops to end up in 1. So I just do 1 divided by 0.5, and that's going to give me my seconds. So what's 1 divided by 0.5?
2.
So that's going to be 1 drop every 2 seconds. So that's going to be, so if this is my starting point, 1 drop every 2 seconds is that. Okay? How you feel about that?
This is good. I really like this pattern.
Okay. But notice we've used this exact same little roadmap on every single calculation, right? We had no formulas to memorize at all. So last week I talked about all the formulas. so that you'd know where these formulas came from and how they're derived. But we're getting the same answers with one system to follow, one roadmap. All right, let's do this one. We're going to go to, let's go to 46. And then I'll skip around a little because I need to finish. All right, so here, let's just go to me. I'll take you out for a moment. Give you a break. Okay, let's go to number 46. We have, in this case, they want the pump rate in milliliters per hour. So we ultimately are trying to end up in milliliters per hour. Now, in this case, let's start with we got a weight here. We have a weight and an order. So let's start with the weight. We've got 80 kilograms. Okay. All right, I'm already in kilograms, so I don't have to go from pounds to kilograms since I'm already there. But to get rid of kilograms, here's what I'm going to do. I'm going to go from kilograms to kilograms, move it to the bottom. Now, let's see. They give me something in milligrams, but they give me an order of 10 micrograms per kilogram per minute. So since this has a kilogram and this has a kilogram, let's just put it in that way. 10 micrograms. Now, notice how I write this. 10 micrograms per kilogram per minute means that the minute also goes to the bottom. So this is the way you would write 10 micrograms per kilogram per minute. Now, I'm just going to put a 1 there to fill that spot. So I've now used my 80. I've used my 10 micrograms per kilogram per minute. The part I haven't used is this milligram part. But right now I'm in micrograms and I need to get to milligrams. Since micrograms is in the top, let's move micrograms to the bottom. So micrograms to the bottom, and let's put milligrams there. What's the relationship of those? 1 milligram is 1,000 micrograms. All right, so now I'm in milligrams, but I got to get to milliliters. Okay, let's see. Oh, but I didn't use this whole part. I didn't use this part yet. So since I have milligrams there, that means milligrams is going to go to the bottom. That's the only way I'm going to cancel it out. Milliliters is going to go to the top. I'm left in milliliters, boom, I have a match. Let's plug those numbers in. What goes with milliliters? That's going to be 250. What goes with milligrams? That's going to be 400. Okay, now let's cancel out what I can cancel out. Oh, wait, hold on. I'm still not done because I need to get in hours. Right now I'm in minutes. So since I have minutes in the bottom, let's put a minutes in the top and then hours in the bottom. Boom, I'm now in hours in the bottom. What's the relationship there? 60 minutes is 1 hour. All right, so now let's cancel out what I can cancel. Did I cover everything? It looks like we did. It looks like we've used all the information. So let's just cancel out what we can cancel out. Kilograms, kilograms, micrograms, micrograms, milligrams, milligrams, minutes, minutes. I'm left in milliliters per hour. Anything else I can cancel? We're just gonna stop right there and let's just put it in the calculator. Let's do these numbers. And what do you get as your final answer? Type it in the chat. What's your final answer? We'll do about 3 more problems and then we'll call it. Anybody still with us on YouTube? Type in your answer. What's our final answer going to be? Okay, our final answer is going to be in 30 milliliters per hour. I would agree with that. Good. All right, let's skip these next 2. I'll leave those 2 for you. We kind of did one like this one. In this case, for number 49, remember you've got to also factor in the drops per milliliter. Okay, but they want to get you in drops per minute. So the way we would set this up, this is going to be, here, let's set this up. Let's do 49. So the way we would do this, let's start with the order here. We're going to put this in, the order is 4 microgram per minute. Okay. Now we have a microgram there, so let's move micrograms. So let's move micrograms to the bottom and let's put milligrams in the top. Our relationship is 1 milligram is 1,000 micrograms. Now I have a milligram in the top. Let's move it to the bottom. Let's move milligrams to the bottom. Let's put milliliters in the top. Now, do I have something that gives me milliliters and milligrams? Yeah. We have 250 milliliters partnered up with 1 milligram. And I have a 60 drop set. I have a milliliter in the top. Let's put milliliter in the bottom, drops in the top. And with a 60 drop set, that's going to be 60 drops in 1 ml. I'm left with drops and I have minutes. So I cancel out what I can cancel. Microgram, microgram, milligram, milligram, milliliter, milliliter. I just do the math. 4 times 250 times 60 divided by 1,000. I'm going to be left with 60 drops a minute. Okay, everybody good with that one? Good. We'll skip the next two. Let's do number. Let's do number 52. Okay, in 52, they want us to have, oh yeah, okay, in this one, they say calculate the dose in milligrams and the volume in ml. So they want 2 things here. So they want something to be in milligrams, but then they also want milliliters. So let's start with the, okay, in this case, we have a weight. So let's start with the patient's weight. This patient weighs 12 kilograms. So that's that part, 12 kilograms. I'm already in kilograms, so I don't have to worry about pounds. I'm already there. But to get rid of kilograms, I got to put kilograms in the bottom, and let's put milligrams on the top. Since they give me stuff about milligrams, what's the relationship between milligrams and kilograms? Oh, well, actually, no, we don't even have to do that because they give us a constant, wait a minute. They actually give us something with milligrams and kilograms already, so we don't even have to do a conversion there. We can just plug those numbers in. We have 0.01 milligrams per 1 kilogram. Okay, I just took care of that part. Now I have milligrams in the top. Let's put milligrams in the bottom. Oh, wait, no, I don't want that because, oh, no, I do. Because I want milliliters. Okay, I forgot. They want us to also get the milligrams. So let's leave off this part and let's just end up with the milligrams so we get that first answer. Because I have milligrams there and I want milligrams there. So let's just stop with that part and get that answer first. So in that case, I'm just going to cancel out my kilogram. I'm left in milligrams. So do 12 times 0.01. And what do you get? What's your answer? Type it in the chat. 12 times 0.01. Did you get 0.12? Do 12 times 0.01. 0.12? Okay, so that first answer is 0.12 milligrams. That's our dose. But we got to figure out how much do I draw up in the syringe. In this case, we got to ultimately end up in milliliters. So now we're going to take this milligrams and let's get rid of it. Let's put milligrams and milliliters. Well, they give us something in milligrams per milliliter, and that's going to be 0.1 milligrams in 1. Oh, wait, I did it wrong. That's going to be 0.1 milligrams in 1 milliliter. Okay, now I can get rid of milligrams milligrams. I'm left in milliliters, which is what I want. Now just do the math. So you could take that 0.12 that we already figured out from this part and then just divide by 0.1. And what do you get? Type it in the chat. Okay. All right. So 1.2. Yeah, I would agree. So 1.2 mLs. How are we going to draw up 1.2? We could just do a 1 ml syringe and draw 1 ml and then draw up 0.2. Okay. Okay, I'll skip those next two just in the interest of time. I'm also providing you the answers with this, and I will provide you a sheet where I've worked out every one of these questions so that you can actually go back and see how I worked it out. Okay, ooh, this is a good one because this is not something that we do or we never talk about much, and that's percentage solutions, okay? Now, you've probably heard of things like, okay, so in this case, the question says, how many grams of dextrose is in this 250 bag of D5? Now, whenever we have D5, that is what we're saying is we have 5% dextrose. Or if we have D10, that's saying we have 10% dextrose. Okay? But when we say percent, so what we have to know is 1%. What that means, if you have a 1% solution, it means that in 1 milliliter, you have 10 milligrams. Okay, so you've got to know this conversion factor. So 1% means that for every ml, you have 10 milligrams. Now let me just back up for just a second, and I'm going to show it to you. At the very top of this, when I was doing the formulas, let's see, where is it? Right here. Yeah, right here. 1% is where you have 10 milligrams per ml. So let's go back to where we were. Where are we? We were here. Okay. So in this case, they want to know how many grams. Okay. So in this case, you have this is a question number 55. Let's set it up. You have a 5% solution. So if 1% means that you have 10 milligrams, 5% means you have how many milligrams? To go from 1 to 5, I multiply times 5. So whatever I do to this, I must do to this. So that means in 10 milligrams, I have 50. I mean, I'm sorry, in 5%, I have 50 milligrams. Okay, 50 milligrams per 1 ml. Does everybody understand that part? All I did is if I said, if 1% means that I have 10 milligrams, if they give me 5%, that's 5 times 10, that's 50 milligrams. Okay, 50 milligrams per milliliter. All I do, same thing. Milligrams are in the top. Let's move it to the bottom. So let's put milligrams in the bottom, but I'm trying to end up in grams. Oh yeah, is there a relationship there? Well, I could go from milligrams to grams. 1 gram is 1,000 milligrams. Okay, now they tell me grams, but I didn't factor in this part yet. Now I have milliliters in the bottom. Let's put the milliliters in the top. So now I have my 250 mLs, which is what they gave me. I've now used all my bits of information. Now I just cancel out what I can cancel. Milligrams, milligrams, milliliters, milliliters. I'm left with grams, which is what I want. Just do the math. 5 times 250 divided by 1,000. What's my answer? What's my answer? Type it in the chat. 50, wait, did I say 5? 50 times 250 divided by 1,000. Okay, and my answer is 12.5 grams. Just like that. Nice. Okay, and I'll leave 2 more of these for you. And I want you to try them out. Do them the same way. So notice here, we have a 2% solution. You notice how like lidocaine in a tube, a lot of times it comes like 2%, or it could be like 1% hydrocodone or something like that. So if 1% means you have 10 milligrams in 1 ml, then that means 2% means you have 2 times 10. So that's going to be 20 milligrams per ml. Okay. So now that I've given you that, I want you to figure out this next question, but let's keep going. So you've got a couple more percentages. And then finally, let's do 2 more problems here and then we'll be done. Let's just do one more. We'll do number 59. Okay? Number 59. Who wants it? Which one of you want to take this one? I mean, don't all volunteer at once. Cody,
Let's do it.
Let's go, Cody. You ready? All right, now bring us on home.
Bear with me.
Okay. I mean, no, we're just going to follow the roadmap, my man. Let's go. So they want this. Okay, this is a 2-part question. This is question 59. They want what volume and what pump rate. So the volume is going to be so many milliliters. The pump rate is going to be in milliliters per hour. Okay, so we got 2 things to figure out here. So since they give us a weight, let's start with the weight. Let's set it up. You ready?
Yep.
All right.
66 pounds on the top.
Okay, you keep going.
Let's put 20 minutes at the bottom.
Wait, say it. Okay. Okay. Yeah, but we can't but they're not saying 66 pounds over 20 minutes, right? Okay. Like, what does that even mean? Give them 66 pounds over 20 minutes. Okay, what am I supposed to do with that? So that 20 minutes is not going to go there. This is just going to be
kilograms?
66 pounds. Now, okay, but now we're going to go from pounds to pounds there, and then we're going to go our kilograms. Remember, 1 kilogram is 2.2 pounds. Now I have a kilogram in the top. Oh, that must mean I put a kilogram in the bottom. Now, let's see, what information do they give us? Now, in this case, they give us information about 20 mLs per kilogram. This is just a fluid bolus, and I'm trying to end up in milliliters, so I could actually just put that there. Because now I have milliliters per kilogram, milliliter per kilogram. So let's just put the numbers in, 20 mLs per 1 kilogram. Now let's just stop there, because right now I'm in milliliters and I want to end up in milliliters. So let's cancel what I can cancel. Pounds, pounds, kilograms, kilograms. Do the math. 66 times 20 divide by 2.2. And what do I end up with?
600.
I end up with 600 milliliters. Okay, so based on this child's weight, we're going to give them 600 milliliters of fluid. We're going to hang a 1 liter bag. Okay, and then that means that in 20 minutes, we need to give 600 of the bag. Okay, but how much am I going to, if I put this on a pump, how much am I going to do per hour? So all I do is I'm still in milliliters, but I got to get in hours. And right now, I don't have time yet. So I got to factor in this time. I want to end up with hours on the bottom. So what would I do here? Now, remember, they give me something over 20 minutes. So that means that number is in the bottom because it's over 20 minutes. So it's something. So 1 over 20 minutes. Okay. Now, how can I get rid of minutes? Since it's in the bottom, let's put it in the top.
Put it
And
in
then
the
let's
top.
put hours in the bottom. Oh, yeah, there's my hours in the bottom. Now I'm in milliliters per hour, which is exactly what I want to be in. What's my relationship between minutes and hours?
60 minutes per 1 hour.
60 minutes in 1 hour. All right, let's cancel what I can cancel. Minutes and minutes. Now I'm left with milliliters per hour. So I could take, since I already figured out the 600 part, which is here, right? Now I just do the rest. So all of this is 600. Do times 60. So 600 times 60 divided by 20.
1800.
Okay, so that's going to be 1800 mLs per hour. Now, whenever you get something like this, you got to make sense of it and say, does that even make sense? Well, let's see. If here's 20, let's do it like this. If this is a clock, if here's 20 minutes, okay, here's 20 minutes, here's 40 minutes, here's 60 minutes. If in 20 minutes I'm going to give 600, and I have 3 sets of those, 600, 600, 600, 600 times 3 is 1800. Okay, that makes sense. So yes, I'm going to give 1800 mLs per hour. Okay, that's a lot of fluids. Okay.
Yep.
And that's how I would do that. Now, I'm going to leave the last one to you. I've also provided you all the answers for the ones that we've done today. So you can, what I want you to do is go back through all of them. Actually take the time to do it. And this is what I was going to show you. So if you notice, I took the time to do every one of these, and I have a lot of practice already. But the more practice I get, the better I get, the faster I get, right? I want you to do the same thing. Now, I want to show you something, though. This is something that's kind of cool. I want you to actually do this yourself. And this is like somebody on YouTube, I think, mentioned that, hey, what if you had like a cheat sheet of like these little drips and things like this, where you could just, instead of having to do the math, if it's things that are like standardized, that you could already have the answer. And so what you'll notice here is I've actually done this with an epi drip. So what I did is I show you how to mix up an epi drip, where let's say you have your cardiac epi. This is your epi 1 to 10,000, or what was formerly that. So it's the one where you have 1 milligram and 10 ml. So your cardiac epi. And what you'll do, you have different options here. You can either put it in a 100 ml bag, a 250 ml bag, or a 1,000 ml bag. We're typically going to use a 60 drop set, so a microdrip set. But what I want you to do is I want you to set it up. So let's say we're going to go 4 micrograms per minute. Well, I've already done the math for you, but let's focus on these first 3. You notice that I have 4 microgram, 4 microgram, 4 microgram per minute in all of them. The only thing that's changing, and then I have 60 drop set, 60 drop set, 60 drop set. The only thing that's changing is my bag size. I have a 100 ml bag, a 250 bag, and a 1,000 ml bag. When you do the math and you're calculating your drops per second, notice that here, with the 100 ml bag, I end up with 1 drop every 1.27 seconds. I don't like that. I don't like decimals in my seconds, right? But here I get a 1-to-1. That's 1 drop every second. I can easily figure that out. I can easily figure out 1 drop every single second, right? So notice that if I use a 250 bag, my math is nice. If I use a 1,000 ml bag, it's 4 drops a second. Do you know how hard it is to calculate 1, 2, 3, 4 drops every single second? I'd rather not have to fool with that. So what I'm saying is, when possible, always mix your epi in a 250 ml bag. It's going to give you nice drops per second. Let's use another example. Let's say we have 8 micrograms per minute. If I use my 250 bag again, I get 2 drops every second. I can kind of figure that out. But if I use my 100 bag, I get 1 drop every 1.25 seconds. There again, I don't like decimals in my seconds. And then here, if I use a 1,000 bag, I now have to see 8 drops falling every single second. Do you know how hard that is? So I'm always trying to make it easy on me. So what is the pattern that you notice? The pattern is it's always best to mix your epi in a 250 ml bag. That's why when I've drawn my little picture here, I'm going to say we're going to take our syringe and we're going to always mix it in a 250 bag. But how do you actually mix it? To mix your epi drip, if it's not pre-mixed and you have to make it yourself, we're going to take this whole syringe, which is 10 mLs. But I can't just put 10 mLs into the bag because that's going to throw off my concentration. Because think about that. If I first have 250 mLs of liquid, and then I put another 10 mLs of liquid, now I have 260 mLs of liquid. I want my final concentration to be in 250 mLs of liquid. So if I'm going to put 10 in, I have to take 10 out. So what I first have to do is I have to pull out 10 mLs of this, let's say this is D5 or saline or whatever your protocols say. First, I draw out 10 mLs and then I put in 10 mLs. And now I'm going to ultimately end up with 250 milliliters, which is what I'm saying here, 250. Notice I don't have a 260 there. Notice I have 100 and not 110. Notice I have 1,000 and not 1,010, right? So I always have to, whatever I'm going to put in, I have to first take it out. Does that make sense? So that ultimately I end up with whatever that number is as the final number inside of the bag. Am I making sense for everybody? Big takeaway is whatever you're going to put in, first take it out when you're mixing your drip, okay? And if you're going to use an epi drip or a nor-epi drip, the bag of choice that really helps you on your calculations is always use a 250 ml bag. Okay? Now, that's all I have for today. That was a lot. But did you learn a lot today? All right, let's do some quick hot takes. For those of you on YouTube, I hope this has been great for you. Monica, how has this been for you? Let's do a couple hot takes and then we're out of here. I'm hungry and everything.
I realize that if you just follow the laid out plan that it works. A few times I put in information in a different order and it still came out the same as long as I took everything from the information that they gave me and put it in where it needed to go.
Okay.
Yeah.
How do you feel about drug calculations and med math now compared to when we started today?
80% better.
Okay. And we got to get you to 100% better because like this actually matters in real life. So what I'm going to encourage you to do.
No, I'm feeling very confident. I was at about a 20% before, now at 80.
Hey, I'll take it. 20 to 80 in one session. That's amazing. Okay. But what you see is that as long as we follow the roadmap and we do our lane changes like we need to, just one step at a time, cancel out what we can cancel out. If it's in the top, let's move it to the bottom. If it's in the bottom, let's move it to the top. That's the way we cancel it out. And then we just plug in things that they give us or information that we have available. And if you'll do this, this will work every single time. Notice that we didn't have any formulas to memorize. We only had one roadmap to follow, one system to follow. And we actually did like 17 types of problems in today's session with one system.
That's awesome.
So I want you to just follow this over and over. And what really will help you is take the time to do it. And I'm also going to provide you my worked out answers so that you see the roadmap that I follow to get to every answer. And I'll provide you with the answer. That way you know, oh yeah, I forgot. I need to add this conversion factor here or that kind of thing.
Sure.
Okay. But you would say this was helpful today, right?
It was amazing.
It was amazing. Okay, Cody, tell us,
Love
this
it.
was your first session with us. How was today?
That was awesome. I definitely would have liked to have this during class.
Okay. Okay. And,
Um,
but it's pretty simple, right?
yeah, just following this pattern. I mean, like you said, you can do all these different problems using one pattern and not multiple different formulas you have to memorize.
Yes. And what I want you to do is actually take the time, go back and do every single problem. Yeah, it may take you an hour or two to do it, but that practice is going to build that kind of muscle memory. This is one of those situations, like I always say, we do not practice things until we get it right. We practice until we cannot get it wrong. Does that make sense? That's a different standard. We never practice until we get it right and then call it a day. We practice until we cannot get it wrong. And this applies to skills or anything. As I always say, any skill that you haven't done in the last week, you want to practice it. If you haven't done traction splint, if you haven't delivered a baby, if you haven't run a code, if you haven't done a pediatric code, if you haven't done a pediatric anaphylactic or a septic shock or an intubation or intubation with paralytics, anything that you haven't done in the last week, you need to be practicing. Sure, yeah, everybody can say, oh, okay, I have my BLS and my ACLS and my PALS, and I'm going to renew those every 2 years. Every 2 years to practice something is no practice at all. Okay, you really want to be practicing this stuff all the time. You want to be drilling your ACLS and your PALS dosages like every day. You want to immediately know, what's my pediatric dose for adenosine? What's my pediatric dose of amiodarone? What's my pediatric dose of lidocaine? The time to figure that out is not when you have a 3-year-old who was pulled out of a house fire. I had this exact call. A 3-year-old who was trapped in a house fire. Firefighters brought me this lifeless 3-year-old. He ended up dying because he had succumbed to smoke inhalation before we got there. He was already trapped for probably 15 minutes before they found him. But that's not the time to figure out, oh, how do I do my drug calculations, right? When seconds matter, you need to be that person, that 3,000 level medic or nurse or doctor or whatever level you're at, who can show up and give the best possible care when somebody's life depends on it. So I hope this was great for everybody. I enjoyed this. This is a topic, I know this was a longer video than probably every other video, but it's such an important topic. I want you to review this often, okay? And this will get uploaded. We'll also get, we'll put timestamps in the video. That'll happen a little later. But for now, you have access to the YouTube video. I will also drop the resources for you. And for those of you in the community, this has been a pleasure. For everybody, this has been a pleasure. But if you're already one of our students, we'll be back tomorrow for our weekly accountability session. That will be much shorter tomorrow. We won't have a session Thursday night this week for office hours because I actually leave tomorrow. So literally right after the session, I'll grab my luggage and take off because I've got to travel again this weekend. So it was a pleasure, everybody. Thanks for joining me for office hours. Everybody have an amazing day. Or any final questions?
I don't have any.
Okay.
I don't have any either. And I think you just filled in one of the blanks that I had preparing for my national. I'm getting ready to schedule that since I am fully done with school now. So I've just been going through some of your stuff and trying to finish the 14-day program and going to get that exam scheduled.
Nice. Okay. Yeah, go ahead and knock it out. And this will be your very first attempt, right?
Yes.
How has your knowledge changed since you joined our 14-day program?
I feel like I've built a lot of confidence because if I can break it down to what the problem is, it seems like it's a lot easier to find the solution.
Okay. And everything's
so,
oxygenation, ventilation, or perfusion.
Exactly. I was struggling with the order in which to do things and your 5 buckets that you went through. I've gone through all of that.
Okay.
It makes it a lot more clear. For some reason, even though you're saying the same thing with oxygenation, ventilation, and perfusion, it was easier to grasp that than just going with ABC,
Absolutely.
airway, breathing, circulation.
Absolutely.
So I appreciate that.
And
So I'm optimistic that it'll go great.
good. We've helped many people pass on their first attempt. I wish everybody started with me on their first attempt. Most people don't start with me until they failed 3, 4, 5 times already. But I wish everybody was you in your situation. But we just, we get people whenever they join us. But we've helped people on their first attempt, second, third, fourth, fifth, or sixth. We've helped people on every attempt be able to pass. But as I often say, I'm not just trying to help you pass the test. Yes, you have to pass, but I need you to pass and be good, because there are way too many people out there who've passed and they're horrible. And I've worked with them.
Yes.
I've been licensed in 5 states, and I've worked with them in every state I've worked in.
Yes, I agree with that. And I've actually found it fascinating, and I found a love for certain areas that I was kind of like, I know enough. And now I'm like, wait, hold on. And so last night I was going to watch, an hour of videos, and watched 3 hours because I was just sucked in to it. So yeah, it's great. Thank you.
Well, hey, that's so cool to hear. And you know what you just said though, is like what I don't want to put words in your mouth, but what I think you're saying is, Coach, you sparked this love of learning again. Like,
yes.
Okay.
Yes, absolutely. And wanting to do best by my patients, that's always been in the forefront. And for me to be able to have the knowledge to do that is going to make me feel like I'm a much better paramedic once I get that.
And what I also want you to think about, Monica, is when you're calling in that report, and well, let me look in the camera so everybody can see me. When you're calling in that report to the hospital, or you're relaying that report once you get to the hospital, think about the confidence that you're going to have when you know what you're talking about. Like when you're calling in an order and you're saying, okay, we've got a crush injury, we've got compartment syndrome, things like that. I'm calling for this because I'm worried about lifting the car and us having all this acidosis. We've talked about acid-base balance.
Mm-hmm.
But when you can just articulate that so well, think about what it does for the person getting the information from you. They now have so much more confidence in you. So now when you're calling for an order, they're like, oh, wait a minute, that's Monica. I recognize that voice. Yeah, Monica, go ahead. Whatever you think you need to do, go ahead. But knucklehead paramedic, who's the 950, they're like, nah, just go ahead and bring them in. We'll evaluate when you get here. That's code for we don't trust you. Okay.
Yeah.
Okay.
And I don't want to be that person. So thank you.
Okay. And I don't say this to brag, but I say this to just impress upon you that I have never been denied an order. It's not that I know everything, but I have practiced this stuff so many times. I've drawn it out. I've said it so many times that it doesn't mean that I won't ever make mistakes, but I'm less likely to make mistakes because there again, I don't practice until I get it right. I practice until I cannot get it wrong. Okay. Now that's a different standard, but that's how I want you to show up every day when you show up. Also, be that clinician that when everybody else is just playing on their phone, on social media, they're gossiping, things like that, which happens in EMS and nursing and healthcare. We have those people, right? But you be the one who, when everybody else is just wasting their time, just wasting their life away, just kind of going through the motions, complaining about management and how management doesn't pay enough. Well, how about instead of waiting for management to give you more, how about you become more? Does that make sense? You become the person that when you show up in the workplace, you now show up at a different level. You bring a different level of value. Whenever I show up with more value, I always make more money. Okay. Like I don't have to settle for what they give me. I can go create my own value based on what I know. Does it make sense? And I want you to do the same thing. Once you continue to just show up as a more valuable person, I promise you the money will follow. Okay.
Sure. Like I said, it's been great. I just finished my paramedic school on Saturday and people are like, you can take a breath. And I said, the learning's just starting. So
amen. I love it.
Yeah, it's great.
I love it. These are my people.
Yeah. So thank you. I appreciate you.
All right. Hey, well, that's it for today because I am hungry. So guys, this was a lot of fun.
Have a good day.
The video will go up soon and I will see hopefully those of you in the community, I'll see you back tomorrow. We will not be streaming on YouTube tomorrow, so I'll just be with those of you in the community. Everybody, have a great day.
All right,
Thank
thanks,
you.
Josh. Come on.
Thanks. Bye.
You're welcome.